Nidana Sthana, Chapter 1, Ashtanga Hridaya Samhita, and the causes of their aggravation are described herein. Thus he says, Now therefore we shall expound the etiology of all diseases. Thus indeed spoke the great sages beginning with Atreya, Ashtanga Hridaya Samhita. These words are synonyms. The causative factors, prodromal symptoms, manifested symptoms, therapeutic suitability, and pathogenesis. Thus, the knowledge of diseases is remembered to be fivefold. By the synonyms and, they call it. The prodrome is that by which an impending disease, not yet fully established by a specific, is recognized. The sign is unmanifest due to its mildness, for diseases, each according to its nature. The very same prodromal symptom that has attained manifestness is called symptom, are synonyms for the beneficial use of medicine, food, and lifestyle that are contrary to the cause and disease, or that produce an effect contrary to the contrary, should be known as therapeutic suitability for the disease, for that is considered suitability. The opposite of which is unbeneficial is known as unsuitability for the disease. The manifestation of a disease by which A is vitiated and by which it spreads is called or. It, is differentiated by number, predominance, strength, and specific time. For example, as will be stated here, there are 8 types of fever. Is the estimation of the parts and subparts of the when they are combined. One should declare the predominance of a disease by its independence or dependence. The specific strength or weakness is determined by the completeness or partiality of the cause, and so on. The time of the disease, according to the dosa, is determined by the parts of night, day, season, and food. Thus, the meaning of etiology has been declared. Therefore, he says, he will explain that in detail. Indeed, the aggravated dosas are the cause of all diseases. The consumption of various unwholesome things is declared to be the cause of their aggravation. What is that? He says, the threefold inappropriate conjunction of time, object, and action mentioned previously is harmful. By foods that are bitter, pungent, astringent, scanty, dry, or limited. By suppressing urges, by stimulating urges, by staying up at night, by excessive loud speaking. By excessive therapeutic actions, by fear, by grief, by anxiety, by overexertion, by excessive sexual activity. Vata dosa becomes aggravated at the end of summer, at the end of the day, and at the end of a meal. One of the 3 dosas is aggravated by pungent, sour, sharp, hot, alkaline anger, and burning substances. And during the 6 seasons, midday, midnight, and at the time of burning sensation. One of the 3 dosas is aggravated by sweet, sour, salty, unctuous, heavy, substances that obstruct channels, and cold substances. By sitting, lack of sleep, comfort, indigestion, daytime sleep, excessive nourishing by improper emesis and other therapies immediately after eating in spring, in the forenoon, and in the first part of the night. A dual e.g. arises due to the mixing of causes. Furthermore, the simultaneous aggravation of all 3 arises from the mixing of all causes. It also arises from consuming mixed, undigested, irregular, or incompatible food, and from overeating. From consuming spoiled alcohol or water, dry vegetables, raw radishes, oil cake, mud, a type of liquor, putrid, dry, or emaciated meat, from various substances that cause all 3, and from changes in food, from a vitiated season, from easterly winds, from possession by planetary influences or spirits, from poison, from artificial poison, from spoiled food, from contact with mountains, from affliction of the birth star by, from various improper treatments, and from the performance of sinful acts, from abnormalities in women's delivery, and from improper management of the puerperal period. Regarding each disease, the enraged going to the seats of the diseases quickly enter the channels and cause disorders in the body. Thus, in the composed by Srimad Vagbhata, son of Sri Vidyapati Simhagupta, in the 3rd section, Nidana Sthana, the first chapter named Sarvaroganidana is concluded. Chapter 2. Now, therefore, we shall expound the etiology of fever. Thus indeed spoke the great sages, Atreya and others. Fever is the lord of diseases, sin death the devourer of the destroyer. It is the wrath born from Rudra's upward-gazing eye, which destroyed Daksa's sacrifice. It is delusion filled at the beginning and end of life. Its essence is burning, and it arises from transgression. Cruel with various names, it manifests in diverse species. It arises in 8 ways, from the individually, mixed, or combined. And it is exogenous, the waste products doses, there, corrupted by their respective vitiating factors, enter the stomach, follow the undigested food and obstruct the channels. They also expel the digestive fire from its place of digestion outwards, moving along with that expelled fire, heating the entire body and making the body extremely hot. They produce fever. Due to the obstruction of the channels, sweating generally does not occur. Its prodromal symptoms are laziness, disinterest, heaviness of the body, tastelessness in the mouth, anorexia, yawning, eyes tearful and agitated, body aches, indigestion, low vitality, excessive sleep, horripilation, bending of the body, cramping in the calves, exhaustion, intolerance towards beneficial advice, liking for sour, salty, and pungent foods, aversion to sweet foods, and also to children, intense thirst, and causeless desire and aversion towards sounds, fire, cold, wind, water, shade, and heat. Thereafter, the manifestation of fever occurs. The irregularity of the coming and going, agitation, softness, pain, and heat in various parts of the body are the characteristic pains of one of the three, which are unstable. Numbness and stiffness in the feet, cramping in the calves, fatigue, a feeling as if the joints are dislocated, weakness in the thighs, stiffness in the waist. The back feels as if it is being crushed, the abdomen feels as if it is being squeezed, and the bones, especially those in the sides, feel as if they are being split. There is gripping and pricking pain in the heart and in the chest as if being prodded. There is churning in the shoulders, splitting pain in the arms, and squeezing in the shoulder blades. Inability to chew with the jaws, yawning, ringing in the ears, pricking pain in the temples, headache, a tasteless mouth, or an astringent taste in the mouth, and non-elimination of waste products. Dryness and reddishness of the skin, face, eyes, nails, urine, and feces. Excessive salivation, anorexia, lack of faith, indigestion, absence of sweating, and sleeplessness. Simultaneous affliction of the limbs, delirium, a pungent taste in the mouth, ulceration of the nose and mouth, desire for cold, dizziness, fainting, intoxication, and restlessness. Diarrhea, vomiting of one of the three, spitting of blood, and sourness. Eruption of red boils, yellowish-green discoloration of the skin and other tissues. Sweating, foul-smelling breath, and excessive thirst are characteristic of disorders caused by. In diseases arising from one of the three, there is a lack of desire for specific things, dullness, obstruction of channels, and slow movement. Excessive salivation, sweetness in the mouth, a feeling of heaviness in the heart, asthma, and rhinitis. Nausea, vomiting, cough, stiffness, whiteness in the skin and other tissues. Cold eruptions on the limbs and urticaria, or the manifestation or increase of all of them at their proper time. Non-alleviation by what is stated as the causative factors, and alleviation by their opposites. When there is a combination of symptoms according to their respective natures, the fever is born of combination. And also, headache, fainting, vomiting, burning sensation, delusion, dryness of the throat and mouth, restlessness, splitting pain in the joints, sleeplessness, thirst, giddiness, horripilation, yawning, and excessive speech occur from combined with loss of heat, anorexia, pain in the sides and head, rhinitis, dyspnea, cough, and constipation. Coldness, stiffness, darkness before the eyes, giddiness, and stupor are the symptoms of fever born of phlegm and wind. Irregularity of cold, stiffness, sweating, and burning sensation, thirst, cough, and increased and bile. Delusion, stupor, and a coated, bitter taste in the mouth are known to be the characteristics of fever. The all-originating fever is known by all symptoms. In this condition, there is repeated burning sensation. Similarly, coldness, great sleepiness during the day, and wakefulness at night. There may or may not be sleep always, and there may or may not be excessive sweating. There is an inclination towards distorted activities like singing, dancing, and laughing. The eyes are tearful, turbid, red, crooked, and have disheveled eyelashes. There is pain and dizziness in the calves, sides, head, joints, and bones. The ears are noisy and painful, and the throat feels as if covered with awns. The tongue is burnt, rough, and heavy. There is looseness of the body's joints. There is expectoration of blood, bile, and phlegm, excessive pain and shaking of the head. The appearance of blackish red, urticarial rashes, and circular patches. There is heart pain, retention of waste products or their discharge in small or excessive amounts. The face is oily, there is loss of strength, hoarseness of voice, and delirium. The bodily humors mature slowly, there is drowsiness and continuous cooing in the throat. That fever should be called prostration, and one whose is diminished. When the is obstructed and the is destroyed, a fever caused by the simultaneous derangement of all three, with all its symptoms complete, is incurable. Otherwise, that fever becomes difficult to cure, or it may even cause deformity. Furthermore, in another, fever caused by the simultaneous derangement of all three, where remains separate. It causes burning in the skin or in the alimentary tract, either before or after. Similarly, and cause cold. The one with burning, etc., is more difficult to treat among these two. In the cold predominant type, when is liquefied and dried up by, and the cold subsides, then sour eructation, fainting, intoxication, and thirst arise. In the fever with burning sensation at the onset, however, at the end there are drowsiness, spitting, vomiting, and exhaustion. Exogenous fever is of 4 types: from injury, from affliction, from a curse, and from sorcery. Here, the injury-borne fever is caused by wounds, cuts, burns, etc. And from exertion, in that vata predominantly vitiating the blood causes fever with pain, swelling, discoloration, and severe aching. Fever born from possession by, from medicines, from poison, from anger, from curses, from grief, from desire. From affliction, due to in this fever, there is sudden laughter and crying. From the smell of poisonous herbs, there is fainting, headache, vomiting, and sneezing. From poison, there is fainting, diarrhea, blackness of the mouth, burning sensation, and heart disease. From anger, tremor, and headache occur. Delirium in fevers born of fear and grief. From desire, sexual longing, there is giddiness, anorexia, burning sensation, loss of shame, sleep, intellect, and fortitude. In the first group of 3, fevers, like those from possession, there is an aggravation of all 3. In the second group of 3, fevers, like those from fear, there is an aggravation of vata. In the fever from anger, there is an aggravation of. Those 2, however, which are born of curses and black magic, are terrible, fevers caused by the derangement of all 3, and are considered the most unbearable. There, for one upon whom's incantations, pertaining to black magic, are being offered into the fire. First the mind is afflicted, then the body, then afflicted by eruptions, thirst, delusion, constant burning sensation, and fainting. The fever increases day by day. Thus, fever is seen to be of 8 types. In brief, it is also of 2 types: physical and mental, mild and intense, internal and external in origin, natural and unnatural, curable and incurable, with and without. In a physical fever, there is first heat in the body. In a mental fever, it is first in the mind. Now he explains the mild and the sharp. Due to wind property of being a carrier, coldness occurs when it is associated with phlegm, burning sensation when associated with, a mixed condition when mixed with and. Furthermore, in a fever with internal localization, the symptoms are more pronounced internally. There is internal agitation and retention of waste products. In the external pathway, the fever is also external, and it is easily curable. In the rainy season, autumn, and spring, fevers caused by and the other respectively are natural. Any other fever is unnatural and difficult to cure. Generally, even a natural fever caused by vata is difficult to cure. In the rainy season, wind, i.e., vitiated and accompanied by and causes fever. And in autumn, and is its secondary strength. Due to its inherent nature and the period of release, there is no fear from not eating in that fever. In spring, and will be secondary to that. Fever in strong individuals with few and without complications is curable. The incurable disease in all its forms has been described previously in the chapter on the knowledge of deformities. The intensity of the complications of fever, lack of lassitude, excessive urination, no evacuation, undigested feces, no hunger. These are the characteristics of fever with undigested. An increased intensity of fever, excessive thirst, delirium, dyspnea, vertigo, and the expulsion of stools with distress are the symptoms of a fever that is undergoing maturation. The matured state of fever occurs from the reversal of undigested state symptoms and after fasting for 7 nights. Fever is declared to be of 5 types based on the strength and weakness of the doses and time. It is mostly described as arising from confluence of all 3 doses. The fevers. The doses, pervading the channels carrying tissues, urine, and feces, heating the entire body, augmented by similar tissues, etc., being strong, heavy, stable, and especially lodged in the plasma. Constantly, without opposition, cause a very difficult fever. The feverish heat quickly destroys or tissues. Then, by complete purity or impurity of another in due order, due to, and it mostly follows a limit of 7, 10, or 12 days for liberation or for destruction. This is the opinion of Agnivesa. Harida's recollection, however, is as long as double the 7th, 9th, and 11th days respectively. This is the limit for the 3 for liberation or for destruction. In a state of purity and impurity, the fever continues for a long time. In emaciated persons, those recovered from illness, and those indulging in improper diet and activities, even a slight having gained strength from any one of the vitiated substances, etc., accompanied by its antagonist, causes an irregular fever characterized by decrease and increase. A powerful, one of the 3 bodily humors, manifests in its own time, causing fever. This same then recedes, its strength diminished by its antagonists. When the is diminished, the subtle fever remains latent in the plasma and other tissues. Due to its latency, it causes emaciation, discoloration, dullness, and other symptoms. Due to the channels carrying being near and open-mouthed, the quickly pervades the entire body. Continuous fever is therefore uninterrupted. Intermittent fever is the opposite, due to the reverse. Intermittent fever has uneven onset, action, and time, and is long-lasting. The residing mostly in the blood causes continuous fever. It occurs twice in a day and night, once on alternate days. In that, the channels carrying muscle tissue, the channels carrying fat tissue, in tertian fever. It seizes the head from and vata, the sacral region, from and with the back from and it is known to have a 1-day interval. The quartan fever occurs when the dosa is situated in one of fatty tissue, bone marrow, or bone. Others say it is only situated in the, but it manifests its effect in 2 ways. Due to one of the 3 dosas, it first appears in the shanks, and due to vata, it first appears in the head. When it is situated in both, and it is inverted quartan fever. It causes fever for 2 days and releases for 1 day. Fever arises from the strength and weakness of the born from food activity, etc. Similarly, it arises from the mind and from actions at various times. Fever attains its specific time based on the strength of the seasons, day and night, etc., and the mind and sense objects. The agitating the dissolves at the time of remission. Then the person breathes, sweats, groans, vomits, and moves. He trembles, raves, his limbs are hot and cold, and he is deprived of luster. Unconscious, afflicted by the intensity of the fever, he looks as if angry. He discharges liquid feces with and sound with force. The body is light, weariness, delusion, and heat are gone. There is digestion in the mouth, clarity of the senses, freedom from pain. Sweating, sneezing, the mind is in its natural state, desire for food, and itching on the head. These are the signs of a fever's remission. Thus, in the composed by the illustrious Vagbhata, son of the illustrious Vidyapati Simhagupta, in the 3rd section, Nidana Sthana, the 2nd chapter named Varanidana, Diagnosis of Fever, is concluded. Chapter 3. Now, we shall expound the etiology of a disease characterized by bleeding from various orifices and cough. Thus spoke the great sages, Atreya and others. By excessive consumption of foods that are very hot, sharp, pungent, sour, salty, etc., and causing burning sensation, and by foods like paspalum scribiculatum and wild rice, mixed with those hot, sharp, etc. substances, the one of the 3, which is liquid, becomes aggravated by pitta-aggravating substances, and the blood also becomes aggravated. When these 2 and become mixed, conjoined, they attain a similar appearance to each other and pervade the body, is referred to as blood, due to its association with the vitiated and also due to its vitiation of, and because of its following the smell and color of. That, blood, originates from the seat of blood, the spleen, and the liver. Now he states its premonitory symptoms. Heaviness in the head, anorexia, desire for cold, a sensation of smoke, sour eructations, vomiting, aversion to vomited matter, cough, dyspnea, giddiness, fatigue, a mouth smelling of iron, blood, or raw fish, loss of voice, and a blood-red, yellowish, or green discoloration in the eyes and other parts, inability to distinguish blue, red, and yellow colors, and seeing objects of these colors in dreams occur when this disease is about to manifest. Therein, he speaks of the upward moving. When aggravated, it flows upward through the nose, eyes, ears, and mouth, and downward through the penis, vagina, and anus. It also flows through all the hair follicles. Upward moving is curable because purgation is its means of treatment, and it involves many medicines. Indeed, purgation is the best medicine for, and it also purifies the one of the three that is associated with it. Astringent and sweet tastes are beneficial for this person whose another name for has been purified. What then of bitter or astringent tastes, which by nature alleviate? The downward moving Raktapita is manageable because it arises from Vata and it is treated by emesis. It has few medicines, and emesis is not the best medicine for. And Vata is the associated factor, and emesis is not for its pacification either. And only sweet astringents are beneficial for it. That which is mixed with an IE and flows in both directions is incurable, because its counteraction is impossible, and because there is no medicine for it. For there is no purificatory therapy that acts in a counter-directional manner for this. The purification that acts in a counter-directional manner is the treatment for a disorder characterized by bleeding. Similarly, there is no palliative therapy whatsoever. For when they are mixed, a palliative that conquers all is beneficial. In that condition, one should ascertain the involvement of the just as in venesection, and the complications are known from the nature of the disease, and among them cough is more severe. Therefore, he will now describe that vary because it acts quickly. 5 types of cough are remembered, caused by injury and wasting. All of them, if neglected, lead to wasting, and progressively stronger. The premonitory symptoms of these coughs, yet to manifest, are itching in the throat anorexia, a feeling as if the throat is filled with bristles. There, the wind, obstructed downwards, having moved upwards, reaches the chest and clinging to it and to the throat, filling the channels of the head, then as if throwing up the limbs, as if throwing out the eyes, pressing the back, chest, and sides. It emerges through the mouth with a sound like a broken bronze vessel. Due to the difference in causes, there is a difference in the obstruction of the wind, along with force. From this arises the irregularity in pain and sound of the coughs. When provoked by Vata aggravating factors, causes dryness in the chest, throat, and mouth, pain in the heart, flanks, chest, and head, delusion, agitation, and loss of voice, and a dry cough with great force, pain, and sound. That cough causes horripilation, and after expelling dry with difficulty, it subsides. From there is yellowness of the eyes and a bitter taste in the mouth, fever, dizziness, vomiting of and blood, thirst, hoarseness, a sensation of smoke, and sourness. Due to the continuous force of the cough, there is a perception as if seeing lights. From one of the 3, there is slight pain in the chest, and the head and heart feel heavy and stiff. There is coating of the throat, debility, rhinitis, vomiting, anorexia, horripilation, and the expectoration of thick, unctuous, white phlegm. Due to various acts of excessive exertion like fighting performed beyond one's strength, or due to an internal injury in the chest, the strong, one of the 3, accompanied by, becomes aggravated and causes a cough. Through this, he expectorates phlegm mixed with blood, which is yellow, dark, dry, lumpy, putrid, and abundant. He spits it out with a painful throat, and his chest feels as if it is torn apart, as if being pricked by sharp needles, and he suffers from pain. He experiences joint pain, fever, dyspnea, thirst, hoarseness, and tremors. He coos like a pigeon and suffers from pain in the flanks. Subsequently, his vigor, appetite, digestion, strength, and complexion gradually diminish. When emaciated, there is blood in the urine and stiffness in the back and waist. In a patient of consumption, the bodily tissues, predominantly when aggravated, cause a cough due to the causes of. Then one expectorates sputum, which is putrid, pus-like, yellow, foul-smelling, and greenish-red. The sides feel as if being torn, and the heart feels as if falling. There is a sudden desire for hot or cold, excessive eating, and loss of strength. The face is unctuous and clear, and the teeth and eyes are lustrous. Then, all the symptoms of wasting manifest in him. This consumptive cough is destructive to the bodies of emaciated individuals. It is manageable for strong individuals, and similarly, cough due to injury, and the 2 recent ones, may be curable with proper support. The 3 coughs caused separately by the are curable. Those mixed coughs from 2 dosas are manageable. All coughs in an old person due to old age are also manageable, because diseases such as dyspnea, consumption, vomiting, and hoarseness arise from neglecting a cough. One should quickly conquer it. Thus, in the composed by the illustrious Vagbhata, son of the Lord of Physicians Simhagupta, in the third Nidana Sthana. The third chapter, named Raktapita Kasa Nidana, is concluded. Chapter 4. Now we shall expound the etiology of dyspnea and hiccup. Thus, indeed, said the great sages, headed by Atreya, dyspnea may arise from an increase in cough or from the aggravating factors mentioned previously. Also from diarrhea with undigested food, vomiting, poison, anemia, and fever. From dust, smoke, wind, injury to vital points, and excessively cold water. There are 5 types, and the 5th, when wind has its movement obstructed by and is situated everywhere. It vitiates the channels that carry life breath, water, and food. This vitiated located in the chest causes dyspnea, originating from the stomach. Its premonitory symptoms are pain in the heart and flanks and upward movement of breath, flatulence, constipation, and splitting pain in the temples. There, wind, provoked by exertion and excessive eating, impels the minor type of, which subsides on its own. When wind dosa moves in the reverse direction in the channels, it excites phlegm dosa, and seizing the head and neck and pressing the chest and sides, it causes cough, gurgling, fainting, anorexia, rhinitis, and thirst. It also causes dyspnea with intense force which afflicts the vital breaths. Due to its intensity, the person faints but feels momentary relief after expectoration. Lying down, he breathes with difficulty. Sitting up, he attains comfort. His eyes are raised, his forehead sweats, and he is greatly distressed. His mouth is dry, he breathes frequently, desires warmth, and trembles. It is aggravated by clouds, water, cold, easterly winds, and kapha increasing substances. This asthma is manageable but not curable, but if it is new and occurs in a strong person, it is curable. When accompanied by fever and fainting and alleviated by cold, that is a type of asthma. Ayurveda Rasayana. He describes the characteristic of a specific type of with, accompanied by fever and fainting. He breathes intermittently, afflicted by pain that feels like cutting the vital organs. He sweats and faints, has abdominal distension, burning in the bladder, and urinary retention. His gaze is downwards, his eyes are disturbed, he faints, and one eye is red. His mouth is dry, he raves, is miserable, has lost his aura, and is unconscious. He breathes with a great, piteous sound, groaning, being agitated and disturbed like a rutting bull constantly, with lost knowledge and understanding, with bewildered eyes and face, striking his chest, with obstructed urine and feces, with broken speech, with a dry throat, repeatedly fainting, with extreme pain in the ears, temples, and head. He breathes long and upwards, and does not draw the breath downwards, with the channels of his mouth obstructed by phlegm, afflicted by enraged air vata. He looks upwards, with bewildered vision, casting his eyes around, lamenting as his vital points are being cut, with obstructed speech. These types of when indistinct may be curable, when distinct they are certainly fatal. Thus ends the chapter on the diagnosis of dyspnea. Now, the diagnosis of hiccup. Hiccups have the same causes, prodromal symptoms, number of types, and inherent nature as dyspnea, and, therein, oppressed by food and drink, that are dry, sharp, rough, and unwholesome when consumed improperly, causes a hiccup that is painless, low-pitched, and accompanied by sneezing. That which subsides with wholesome food and drink is called food-borne. Due to exertion, wind dosa causes the minor hiccup. It originates from the root of the clavicle, has a mild force, and is gentle. It increases when one exerts oneself and becomes mild immediately after eating. That hiccup, which manifests slowly with paired urges during eating, increases as digestion approaches and during digestion, shaking the head and neck of one who is distended and extremely thirsty, and who suffers from delirium, vomiting, diarrhea, eye discharge, and yawning. That is the paired, forceful, and digestive. In a person whose pair of eyebrows and pair of temples are stiff and whose eyes are tearful and unsteady, the great hiccup manifests, stiffening the body and speech, stealing memory and consciousness, obstructing the passage of food, causing agitation of the vital spots, bending the back and causing emaciation of the body. It has a great root, is loud-sounding, of great force, and of great strength. That which manifests from the large intestine or from the navel as before, and which repeatedly causes yawning and stretching of the limbs, with a deep resonance, is the deep hiccup. Among them, one should treat the first 2. One should reject the last 2, and also with all symptoms. And all types of hiccup arising in a person whose undigested food is accumulated, who is old, who is given to sexual intercourse, whose body is emaciated by diseases, or who is weakened by cessation of food. Thus ends the chapter on the Nidana of hiccup. All diseases lead to destruction, but not so quickly as hiccup and dyspnea, for they take their abode at the time of death. Thus, in the third Nidana Sthana of the Ashtanga Hridaya Samhita, composed by the illustrious Vagbhata, son of the Lord of Physicians Simhagupta, ends the fourth chapter, named Svasahidmanidana. Chapter 5. Now, therefore, we shall expound the etiology of consumption and other diseases. Thus indeed spoke the great sages, Atreya and others. Now, the etiology of. It is accompanied by many diseases, and many diseases precede it, and thus it is remembered. Formerly, the moon, Soma, was born from the lunar mansions and the Brahmins, and because it afflicted the king Soma and was a wasting disease, it is therefore known as the king's consumption. It is called wasting because it causes the wasting of the body and the medicinal substances, and it is called because it arises from that wasting. It is called drying up because it dries up the body fluids and other. It is the king of diseases because it reigns supreme among them. Excessive exertion, suppression of urges, depletion of reproductive fluid, vital essence, and unctuous substances, and abandonment of proper food and drink regimens. These are the four causes of that disease. That wind, being provoked, and having provoked and everywhere, enters the joints of the body and the channels, pressing them. Having obstructed the openings of the channels, or having excessively dilated them, it moves upwards, downwards, and sideways, and thus generates diseases according to its own nature. The premonitory symptoms of that consumption are severe rhinitis and frequent sneezing, excessive salivation, sweetness in the mouth, weakness of digestive fire and body, seeing impurity in pure food and drink, even in clean places, frequent falling of flies, grass, hair, etc. into food and drink, nausea, vomiting, anorexia, and loss of strength even when eating. Examining one's hands, swelling of the feet and face, excessive whiteness of the eyes, curiosity about the size of one's arms, seeing disgust in one's body. Fondness for women, alcohol, and meat, feeling of aversion covering the head, excessive growth of nails and hair, and in dreams being overcome by insects, chameleons, snakes, monkeys, wild animals, and birds, climbing onto piles of hair, husks, ashes, etc., seeing deserted villages and regions, and drying up of water, falling stars and mountains, and burning trees. Rhinitis, dyspnea, cough, pain in the head and throat, anorexia. These occur when vata is upwards. Diarrhea and emaciation when downwards, and vomiting when in the abdomen. When located sideways, there is flank pain and roaring sound. When in the joints, fever occurs. These 11 symptoms arise in a person suffering from consumption. One should know their complications: throat obstruction, chest pain, yawning, body ache, spitting, weak digestion, and foul breath. In that due to headache, flank pain, body ache, throat obstruction, hoarseness of voice. Now, the form of born symptoms is described there from etc. The separate mention of the shoulder is for emphasis. From one of the three in the feet, shoulders, and hands, there is burning, dysentery, blood, vomiting, bad breath, fever, and intoxication. From one of the three, there is anorexia, vomiting, cough, heaviness in the head and body, salivation, rhinitis, asthma, hoarseness of voice, and diminished digestive fire. Ashtanga Hridaya Samhita, when the bodily humors, with their phlegm predominance and accompanied by a coating, cause the digestive fire to be weak, and when the mouths of the channels are obstructed and the fires of the tissues are diminished, then the plasma chyle, being subjected to improper digestion in its own place, produces various complications. Not reaching the muscle and other tissues, the blood rushes upwards. The food is digested only in the alimentary tract by the digestive fire alone, and mostly turns into waste products, being insufficient for the nourishment of the of this person is not even sufficient for the blood, much less for the muscle. He, the emaciated one, is merely sustained by feces. Ashtanga Hridaya Samhita. One should reject a person who is emaciated, even if the symptoms are slight, and who is unable to withstand the strength of the disease and the medicine. One should certainly treat if it is otherwise, even if all symptoms are present. Thus ends the chapter on the etiology of. Now, the etiology of hoarseness of voice, arises from the bodily humors, individually, collectively, from depletion, and the sixth type is from fat tissue. Among these, due to the voice is feeble, rough, and unstable. The throat feels as if filled with bristles, and there is relief from unctuous and hot things, due to vata. Due to there is burning in the palate and throat, dryness, and aversion to speaking. Due to the throat feels as if coated, the voice is slow and produces a rattling sound. The voice is obstructed. Among these, one should avoid the last one and all others. Thus ends the chapter on the etiology of hoarseness of voice. Now the etiology of anorexia arises from residing in the tongue and heart. The fifth is due to conjunction of all three and mental distress. The mouth, in and other conditions, is successively astringent, bitter, and sweet. In, arising from all, it is tasteless. In grief, anger, etc., it is according to the waste product. Thus ends the chapter on the etiology of anorexia. Now the etiology of vomiting. Vomiting is caused by the individually, by all of them together, and the fifth type is caused by disagreeable objects. The vitiated, a type of, throws all the upwards in all conditions. In these types of vomiting, nausea, excessive salivation, watery discharge from the mouth, and anorexia are the foremost premonitory symptoms. One of the three, causing pain in the navel and back and in the sides, expels food upwards. Then one vomits intermittently in small amounts, astringent, frothy, accompanied by sound and belching, black, clear, with difficulty and with force. It is accompanied by cough, emaciation, heart pain, head pain, voice affliction, and exhaustion. Due to one of the three, one vomits a substance resembling alkaline water, smoky, greenish-yellow, bloody, sour, pungent, and hot, accompanied by thirst, fainting, burning sensation, and heat. From one of the three, one vomits unctuous, thick, cold, and stringy material, as if it were latticed with phlegm threads. It is sweet, salty, abundant, continuous, and causes horripilation. The patient experiences swelling and sweetness in the mouth, stupor, nausea, and cough. One should abandon treatment for vomiting that exhibits all the symptoms from all the waste products and that which is declared as a fatal prognostic sign. When the mind is agitated and the heart afflicted by seeing or hearing foul, impure, unclean, or hateful things, vomiting arises from contact with hateful objects. In vomiting caused by worms, thirst, intoxication, or longings of a pregnant woman, one should examine the and other bodily humors. One should especially declare vomiting to be worm-induced by pain, tremors, and nausea, and by the symptoms of worm-induced heart disease. Thus ends the chapter on the etiology of vomiting. Now, the etiology of heart disease. 5 types of heart diseases are remembered. Their origin is from the same causes as those stated for abdominal tumor. Due to the heart experiences extreme pain, feels as if it is being churned and as if it is bursting. The heart is pierced, dried up, stiff, empty, and fluid-filled. There is sudden dejection, sorrow, fear, intolerance of sounds, tremors, constriction, delusion, obstruction of breath, and little sleep. From there is thirst, dizziness, fainting, burning sensation, sweating, sourness, exhaustion, vomiting, sour a sensation of smoke, yellowness, and fever. Due to kapha, the heart is stiff and heavy as if containing a stone. Cough, indigestion, spitting, sleepiness, lethargy, anorexia, and fever occur. With all symptoms by the 3, due to worms, there is blackish, discoloration of the eyes, entry into darkness, fainting, nausea, emaciation, itching, and discharge of. And in this condition, the heart feels as if it is being torn by a saw. One should quickly treat that terrible disease which acts quickly. Thus ends the chapter on the etiology of heart disease. Now, the etiology of thirst. Its aggravation is due to the desiccation of the cooling bodily constituents. The veins carrying water to the root of the tongue, the throat, a part of the respiratory system, possibly the lung or a specific gland, and the palate, become desiccated and arises. Their general symptoms are dryness of the mouth, dissatisfaction with water, aversion to food, loss of voice, harshness of the throat, lips and tongue, protrusion of the tongue, exhaustion, delirium, mental confusion, and other diseases mentioned in a chapter or section on thirst. From wind dosa, there is emaciation, wretchedness, pain in the temples, giddiness of the head, loss of the sense of smell, altered taste in the mouth, loss of hearing, sleep, and strength. It increases from drinking cold water. He now describes the symptoms of type thirst with from one of the 3, there is fainting, a bitter taste in the mouth, constant redness of the eyes, emaciation, burning sensation, and excessive sensation of smoke. When one of the three is aggravated, it obstructs one of the three in the channels that carry water. That is then dried up by that like mud. The throat feels as if covered with awns. There is sleepiness, a sweet taste in the mouth, distension, stiffness of the head, a feeling of wetness, vomiting, anorexia, laziness, and indigestion. When all are involved, all symptoms are present. Thirst also arises from undigested food matter and from the obstruction of food. It is caused by an. When a person, exhausted by heat, suddenly takes cold water, the heat is obstructed and goes to the alimentary tract, causing thirst, which is purely caused by that which arises from excessive drinking, and that which is caused by unctuous substances in a person with sharp digestive fire. And that which arises from food that is unctuous, heavy, sour, and salty is born of one of the three. Thirst, which is of the nature of depletion, is described by the symptoms of depletion of tissue. The intense thirst that arises as a complication of consumption, urinary disorders, fever, or any other long-standing disease is known as of the nature of a complication. Thus ends the etiology of thirst. Thus ends the 5th chapter, named Etiology of Consumption and Other Diseases, in the 3rd section of the composed by the illustrious Vagbhata, son of the venerable Vidyapati Simhagupta. Chapter 6. Now we shall expound the etiology of alcoholism and other related conditions. Thus indeed said the great sages, Atreya and others. Alcohol is sharp, hot, dry, subtle, sour, pervasive, quick-acting, light, expansive, and clear. The essence of vitality is the opposite of this. The qualities like sharpness, which disturb the mind, are also stated in the context of poison. In poison, however, they lead to the end of life due to their intensified action. By its 10 qualities, such as sharp, alcohol agitates the 10 qualities of vital essence, such as dull, and brings the mind to a state of perversion. In the first stage of intoxication, but in the second stage, he is situated in the abode of heedlessness. Struck by evil thoughts, deluded, he considers it happiness. Having reached the juncture of the middle and highest stages, the person, like an unbridled rogue elephant, dull-witted, would not fail to do anything. This state of intoxication is the ground for all blameworthy acts. It is the abode of depravity. This one, intoxication, is the supreme guide to misfortune, which has many paths. In the third stage of intoxication, one lies motionless, like a corpse. The sinful soul, having reached a state worse than death, is more sinful than death itself. When one being addicted does not know righteousness from unrighteousness, happiness from sorrow, gain from loss, or what is beneficial from what is harmful, how can a wise person practice that intoxication? Delusion, fear, grief, anger, and death are inherent in liquor. It is accompanied by insanity, intoxication, fainting, epilepsy, and tetanus. Where there is even a single loss of memory, everything that is unwholesome is present there. Indeed, food consumed improperly leads to disease or even death. Alcohol, too, when consumed improperly, destroys the 3 aims of life: dharma, artha, kama, intellect, courage, modesty, and so forth. Strong individuals, those who have eaten a meal, who consume large quantities of food, who are unctuous, endowed with mental strength and appropriate age, who are accustomed to alcohol, whose lineage is accustomed to it, who have an excess of fat, and who have low endowfes, and whose digestive fire is strong, do not become excessively intoxicated. In the opposite circumstances, those who are overconfident and those who are angry become excessively intoxicated. Also, by sour and dry alcohol when there is indigestion or when consumed in excessive quantity. There are 4 types of alcohol poisoning, from, all combined. All types arise from all, but the designation is based on the predominant. Their general symptoms are delusion, heart pain, diarrhea, continuous thirst, fever, both cold and hot, anorexia, headache, pain in the sides and bones, tremors, piercing pain in the vital points, stiffness of the sacrum, chest constriction, blurred vision, cough, dyspnea, sleeplessness, excessive sweating, constipation, swelling, mental confusion, delirium, vomiting, nausea, dizziness, and seeing bad dreams. Especially from Vata dosa, there is sleeplessness, dyspnea, tremors, and headache. In dreams, one wanders, flies, and converses with spirits. From there are burning sensations, fever, sweating, delusion, dysentery, thirst, and dizziness. The body becomes greenish-yellow, and the eyes and cheeks are red. From kapha dosa, there is vomiting, nausea, sleepiness, urticaria, and heaviness of the limbs. In one who is omniscient, all the symptoms are present. One who, having given up alcohol, suddenly drinks it again, or drinks any other unsuitable substance. For him, and two diseases arise, caused by vata dosa, which are difficult to cure, especially for a weak person. In there is expectoration of phlegm, dryness of the throat, excessive sleep, intolerance to sound, and drowsiness. There is severe pain in the limbs and head, heart and throat diseases, delusion, cough, thirst, vomiting, and fever. But a self-controlled person who has abstained from intoxicants, acting with forethought, is never afflicted by bodily or mental disorders. Thus ends the chapter on the etiology of alcoholism. For one who is dominated by passion, delusion, and improper diet, three diseases arise, which originate from the obstruction of the channels carrying plasma, blood, and consciousness. These are intoxication, fainting, and collapse, each successively more severe. Now, the chapter on the diagnosis of intoxication. Here is caused by all the bodily humors and also by blood, alcohol, and poison. One whose speech is obstructed, not much, and rapid, whose movements are unsteady and stumbling, whose body is rough, dark, and reddish, will be in a state of intoxication caused by one of the three. One is prone to anger, reddish-yellow in complexion, and fond of quarrels. By one of the three, one speaks little and incoherently, is pale, absorbed in thought, and lazy. The entire self is afflicted by the confluence of all three. From blood, there is stiffness of the limbs and vision, and the signs of one of the three are: by alcohol, there is distorted movement, voice, and body. In poison, there is tremor and excessive sleep, and that intoxication is greater than all others. One should discern the and other in blood and other by the prominence of their symptoms. Thus ends the etiology of alcoholism. The etiology of fainting. Seeing the sky as reddish, black, or blue, one enters darkness. One quickly regains consciousness, but there is heart pain, tremor, and dizziness. Emaciation and a dusky reddish complexion are the characteristics of fainting, that is, caused by. With seeing the sky as red or yellow, one enters darkness and awakens with sweat, afflicted by burning, thirst, and heat. His feces are loose, blue-yellow, and his eyes are disturbed with red and yellow. With seeing the sky as cloud-like, one enters darkness and awakens after a long time with nausea and excessive salivation, with heavy, wet limbs as if covered by damp leather. The one fainting, caused by all three, is like another, epilepsy. It quickly fells a person, rendering them motionless, but without the repulsive movements of epilepsy. Thus ends the etiology of fainting. Now, the etiology of collapse. When the in the body have completed their forceful action in intoxication and fainting, they subside on their own, however, does not subside without medicines. Ashtanga Hridaya Samhita, the exceedingly powerful waste products, having settled together and taken refuge in the vital organs, obstruct the functions of speech, body, and mind, and cause collapse. Due to this, a person becomes like a log, resembling a dead person. He would quickly die if treatment is not applied swiftly. Ashtanga Hridaya Samhita, one should quickly rescue a person sinking into. Just as one would rescue someone sinking into a deep, shoreless expanse of water teeming with crocodiles. Thus ends the chapter on the etiology of a close embrace with one's own enemies, such as pride, arrogance, anger, and joy, and with wine, whether it is appropriate or inappropriate, and whether it is combined with reason or devoid of reason, it becomes equal. Having properly considered strength, time, place, suitability, constitution, assistance, diseases, and age, if one drinks in accordance with these, then one drinks nectar. Thus ends the 6th chapter, named Madhyayada Nidana, Etiology of Alcoholism and Related Conditions, in the 3rd Nidana Sthana, section on etiology of the Ashtanga Hridaya Samhita, composed by the illustrious Vagbhata, son of the Lord of Physicians, Simhagupta. Chapter 7. Now we shall expound the etiology of piles. Thus indeed spoke the great sages, Atreya and others. Because the fleshy growths torment living beings like enemies and obstruct the anal passage, they are therefore called. The bodily humors, having vitiated the skin, muscle, and fat, produce fleshy sprouts of various shapes in the anus and other places. These are called. In brief, they are of two types based on the distinction of being congenital or arising later, and also of two types based on the distinction of being dry or exuding. The anus is connected to the large intestine. In it are 3 folds measuring 4.5 finger breadths. Among these, the is internal, and in the middle is the. External to it is the, and outside that, at one, are the anal lips. Their measure is 1.5 barleycorns, and beyond that are hairs. The cause of congenital piles is the affliction of the seed of the folds. This affliction of the seed is due to the misconduct of the parents, and also due to destiny. From these two, there is an aggravation of all 3, hence those congenital piles are incurable. In this way, all diseases that are hereditary are declared incurable. Congenital piles are especially rough, difficult to see, inwardly directed, pale, and accompanied by severe complications. The other 6 types are due to individual combinations of all 3 together, and blood. The dry ones are due to and kapha, while the moist ones are due to blood and. The causes of aggravation have been stated previously. When the digestive fire is weakened by these, when waste products are excessively accumulated, and again due to excessive coitus, due to agitation from vehicles or sitting on uneven, hard, or elevated seats, due to friction from enema tubes, stones, clods of earth, the thighs, the ground, or rough clothes. Due to frequent contact with very cold water, due to prolonged and excessive straining for defecation. Due to suppressing the urges of urine and feces, or due to forcibly expelling them. Due to emaciation from fever, abdominal lump, diarrhea, undigested food, sprue, edema, and anemia. And due to improper activities, and in women, again, due to miscarriage of an immature fetus or due to pressure from a growing fetus. By these and other such causes, the subtype of becomes aggravated and deposits feces in the anal folds, S. When these folds become swollen and moist, hemorrhoids arise. Its premonitory symptoms are sluggish digestion, mandavanita, constipation, weakness in the thighs, cramping in the calves, dizziness, lassitude in the limbs, swelling of the eyes, diarrhea, or constipation. The one of the 3, which is abundant and obstructed, usually moving below the navel, exits with pain, cutting sensation, difficulty in sound. There is gurgling in the intestines, distension, emaciation, frequent belching, abundant urine, scanty feces, loss of appetite, a sensation of smoke and sour eructations. There is pain in the head, back, and chest, laziness, discolored complexion, drowsiness, weakness of the senses, anger, and difficulty in treatment. There is also apprehension of disorder of the duodenum, anemia, abdominal tumor, and abdominal diseases. These very symptoms, grahanidosa, etc., increase when the hemorrhoids have manifested. The downward moving being obstructed in its downward path by them, the hemorrhoids, becomes reversed and agitates the other, like present in all the senses and the body. Similarly, it agitates the urine, feces, bile, and phlegm, as well as the tissues along with their receptacles. It suppresses the digestive fire. Therefore, a person suffering from hemorrhoids usually becomes extremely emaciated, devoid of enthusiasm, miserable, weak, and utterly lusterless. He becomes devoid of essence and luster, like a tree infested with insects. He is afflicted by all the aforementioned complications and pain in the vital points. Also by cough, thirst, bad taste in the mouth, dyspnea, and rhinitis, fatigue, body aches, vomiting, sneezing, swelling, and fever. He is afflicted by impotence, deafness, visual darkness, urinary gravel, and urinary calculi. His voice is weak and broken. He constantly contemplates, frequently spits, and has anorexia. He experiences pain in all joints, bones, heart, navel, anus, and groin. From the anus, a slimy discharge resembling water from parboiled rice flows. The stool is sometimes constipated, sometimes loose, sometimes dry, sometimes wet, sometimes undigested, sometimes digested, in between. It is pale yellow, green, red, and slimy. The anal piles are rich in bavanila, dry and accompanied by a tingling sensation. They are withered, dusky, reddish, stiff, irregular, rough, and hard. They are mutually dissimilar, crooked, sharp, and have fissured openings. They resemble the fruits of ivy gourd, jujube, date palm, and cotton plant. Some resemble the flowers of burrflower tree, and some are like mustard seeds. They cause excessive pain in the head, sides, shoulders, waist, thighs, and groin. They produce sneezing, belching, constipation, cardiac constriction, and anorexia. They bring about cough, dyspnea, irregularity of digestive fire, ringing in the ears, and dizziness. Afflicted by these, the patient passes stool that is lumpy, scanty, noisy with tenesmus, accompanied by pain, foam, and slime, and is constipated. The skin, nails, feces, urine, eyes, and mouth become blackish. From this very condition, abdominal tumor, splenic enlargement, abdominal diseases, and prostatic enlargement can arise. Those dominated by one of the three are blue-faced with red, yellow, blackish luster. They are thin, constantly exuding blood, foul-smelling, slender, soft, and loose. They resemble a parrot's tongue, liver, spleen, leeches, or kidneys. They cause burning, suppuration, fever, sweating, thirst, fainting, anorexia, stupor, and heat. Their feces are hot, liquid, blue, warm, yellow, red, or undigested. Their skin, nails, etc. are barley grain-shaped, green, yellow, or yellowish-green. Those dominated by one of the three have large roots, are dense, cause mild pain, and are white. They are swollen, enlarged, unctuous, stiff, round, heavy, and firm. They are slimy, motionless, smooth, intensely itchy, and pleasant to the touch. They resemble fruit, jackfruit seeds, or a cow's udder. They cause distension in the groin and cutting pain in the anus, bladder, and navel. They are accompanied by cough, dyspnea, nausea, excessive salivation, anorexia, and rhinitis. They cause urinary disorders, dysuria, headache, dullness, and cold fever. They produce impotence, weak digestion, vomiting, and predominantly undigested material disorders. Their feces are fatty, abundant with and accompanied by dysentery. They do not bleed or burst, and their skin, etc., are pale and unctuous. Due to combination, they have mixed symptoms. From the accumulation, possessing all the symptoms. Piles that are predominantly bloody, endowed with the characteristics of resembling banyan tree sprouts and having the color of berries or coral. When these are severely vitiated and hot and pressed by hard feces, they suddenly discharge blood. Due to its excessive flow, the patient becomes frog-like and suffers from ailments caused by blood loss. He loses complexion, strength, and enthusiasm. His vitality is diminished, and his senses are clouded. By dry and constipating substances like flour of mung bean, kodo millet, a type of caper, and chickpea, one of the three, becoming aggravated and powerful in its own place, obstructs the downward-moving channels and dries up the feces below, causing severe obstruction of flatus, feces, and urine. Due to this, intense pain occurs in the abdomen, back heart, and sides. Abdominal distension, twisting pain in the abdomen, nausea, cutting pain, and especially pain in the bladder along with swelling of the cheeks, and upward movement of wind leading to vomiting, anorexia, and fever. Heart disease disorders of the duodenum, small intestine, urinary obstruction, tenesmus, deafness, visual darkness, dyspnea, headache, cough, rhinitis. Mental disorders, thirst, a bleeding disorder, tumors, abdominal diseases, etc. All these very severe born diseases arise. This upward movement of is considered the supreme complication of piles. It also occurs in those whose abdomen is afflicted by even without piles. Those piles that are congenital or caused by all three, and those that are located in the innermost fold, are incurable. They can only be managed by maintaining the strength of the digestive fire and so forth. Those caused by two and those located in the second fold are said to be difficult to cure, as are those that are a year old. But those that arise in the outermost fold and are predominantly caused by a single, and have not been present for a long time, are easy to cure. In the penis and other places, they will be described according to their respective chapters. Those born in the navel, however, resemble the mouths of earthworms, are slimy and soft. A type of, having seized one of the three, produces piles hemorrhoids on the outer surface of the skin. That which resembles a peg is firm and rough, they know as skin tag wart. Due to there is pricking pain and roughness. Due to there is blackish red discoloration. Due to there is oiliness, nodular consistency, and normal color. A wise person should quickly make an effort for the alleviation of hemorrhoids, for they quickly obstruct the anus and cause obstruction of the anus and abdomen. Thus, in the composed by the illustrious Vagbhata, son of Sri Vidyapati Simhagupta, in the third section, Nidana Sthana, the seventh chapter named Arsasam Nidana, Etiology of Hemorrhoids, is concluded. Chapter 8. Now we shall expound the etiology of diarrhea and malabsorption syndrome. Thus, indeed, said the great sages headed by Atreya. Diarrhea is of 6 types, caused by the bodily humors, individually or collectively, and also by fear and grief. It occurs especially from excessive water intake. from lean, dry meat, incompatible foods, sesame paste, sprouted grains, alcohol, dry and excessive food, hemorrhoids, improper oleation therapy, worms, suppression of urges, and similar causes. The vata dosa provoked by these causes the water element to descend downwards, and by that very it destroys the digestive fire. Affecting the alimentary tract near the feces, it makes the feces liquid, and thus leads to diarrhea. The premonitory symptoms of that diarrhea are pricking pain in the heart, anus, and abdomen, weakness of the body, retention of feces, distension, indigestion. In that diarrhea, due to one of the three, feces mixed with water are expelled in small quantities with sound and pain obstructed. They are rough, frothy, clear, or lumpy repeatedly. Similarly, they resemble burnt jaggery, are slimy, and cause cutting pain around the anus. The person has a dry mouth, prolapsed anus, horripilation, and groans. Due to one of the three, the stools are yellow, black, turmeric-colored, or grass green, bloody, extremely foul-smelling, and the person suffers from thirst, fainting, sweating, and burning sensation. There is pain, burning sensation, and suppuration in the anus, thick due to phlegm. Slimy, fibrous, white, unctuous, raw, accompanied by phlegm. Frequent, heavy, foul-smelling, obstructed, with persistent pain. Sleepy, lethargic, averse to food, passing small amounts with straining, with horripilation, nausea, heaviness in the bladder, anus, and abdomen, and feeling as if not evacuated even after evacuation, all pervading with all symptoms. When the mind is agitated by fear, bile, along with wind, liquefies the feces, then causes rapid, hot, liquid, and floating stools. This is said to be similar to in its symptoms, and similarly from grief. Diarrhea is, in brief, of two types, with undigested and without. It is also with blood or without blood. In the first type, due to its heaviness, it sinks in water. The feces are foul-smelling, and there is distension, obstruction, pain, and frequent discharge. The opposite, the free from stool, even if cooked, sinks due to one of the three. The disease of the duodenum small intestine, that is not very persistent in cases of diarrhea, occurs in another person who consumes things that destroy digestive fire. That by which undigested or digested stool is discharged when the food is digested, that diarrhea is by nature quick-acting due to its excessive flow. The duodenum small intestine disorder causes the stool to be undigested, with undigested food, or sometimes digested when the food is digested, or not at all. Sometimes it is suddenly constipated, sometimes suddenly loose. This disorder, which has been present for a long time, causes defecation due to accumulation. The disorder arises in four ways, from individual bodily humors and from the combination of all three. Its premonitory symptoms are weakness, slow digestion, sour eructations, excessive salivation, bad taste in the mouth, anorexia, thirst, fatigue, dizziness, abdominal distension, vomiting, ringing in the ears, and gurgling in the intestines. The general symptoms are emaciation, a sensation of smoke, a type of asthma, fever, fainting, headache, constipation, stiffness, and swelling of the hands and feet. Among these, due to vata, there is dryness of the palate, a vision disorder, ringing in the ears, pain in the flanks, thighs, groin, and neck, frequent cholera-like symptoms, craving for all tastes, hunger, thirst, cutting pain in the anus, flatulence when food is digested and being digested, and comfort after eating. One is suspected of having heart disease due to vata, abdominal lump, piles, splenic enlargement, and anemia. One repeatedly passes feces that are liquid, dry, thin, undigested, noisy, and frothy after a long time and with difficulty, accompanied by anal pain, dyspnea, and cough. Due to one passes liquid feces that are bluish-yellow or yellowish, afflicted by putrid and sour eructations, burning in the heart and throat, anorexia, and thirst. When food is digested with difficulty due to one of the three, there is vomiting, anorexia, coating of the mouth, excessive salivation, cough, nausea, rhinitis. The heart feels stiff, the abdomen feels heavy and immobile. Eructation is foul and sweet, there is debility, lack of sexual desire for women, passage of heavy stools mixed with undigested, and weakness even in one who is not emaciated. In all three vitiated, there is a mixture of all symptoms. And those three, digestive fires, irregular, etc., which were mentioned in the section on the body's divisions, they also become disorders of is the cause of health, diseases of calculus, skin diseases, urinary disorders including diabetes, abdominal diseases, fistula in ano, hemorrhoids, and sprue syndrome. These are the 8 great diseases, very difficult to cure. Thus, in the composed by the illustrious Vagbhata, son of the Lord of Physicians Simagupta, the 8th chapter, named Atisara Grahanadosa Nidana, Diagnosis of Diarrhea and Sprue Syndrome, in the 3rd section, Nidana Sthana, is concluded. Chapter 9. Now, therefore, we shall expound the etiology of obstruction of urine. Thus declared the great sages, Atreya and others. The urinary bladder, head of the bladder, penis, waist, scrotum, and anus are said to have a single connection, being situated in the cavity of the anal bone. Even though the bladder is downward facing, it is continuously filled from its sides by subtle openings of the urine-carrying channels, which are constantly flowing. The pathological humors, entering the bladder through these very channels, cause 20 types of urinary obstructions and urinary disorders, which are difficult to cure and affect the vital points. In difficulty due to, there is pain in the bladder, groin, and penis, and one urinates little by little, repeatedly. In the type yellow, always with burning pain, or bloody. In the type, there is heaviness and swelling of the bladder and penis, with sliminess and obstruction. By all waste products, it is of the nature of all. When obstructs the mouth of the bladder and dries up, the urine, which may be mixed with or semen, then, in sequence, a terrible calculus arises, like ox gall from a cow due to, and all have as their substratum. Now, its premonitory symptoms are distension of the bladder and severe pain all around in the regions adjacent to it. The urine has a smell like a goat. There is painful urination fever and anorexia. The general symptoms are pain in the navel, perineal raphe, and the top of the bladder. When the calculus obstructs the passage, the urine stream becomes fragmented. When it moves away, one urinates comfortably, and the urine is clear, resembling gometa gem. Due to its agitation, if there is a wound, or due to exertion, there will be excessive pain, accompanied by blood. Due to a person afflicted with severe pain grinds his teeth and trembles. He presses his penis and navel, constantly groaning. He passes feces with and frequently urinates drop by drop. His calculus is dark, rough, and appears covered with thorns, with the bladder burns as if being cooked and is hot. The calculus is shaped like a seed, red, yellow, or black. With the bladder feels as if it is being pricked, is cold and heavy. The calculus is large, smooth, honey-colored, or white. These calculi occur in children, and for them mostly, due to the smallness of their sight and growth. They are easy to grasp and remove. But seminal calculus occurs in adults due to the suppression of semen. Indeed, when semen, displaced from its site, is not released, vayu, dries it up, collecting it between the testicles. That dried semen is a calculus. It causes bladder pain, difficult urination, and swelling of the testicles. When it has just formed and this region is pressed, semen comes out and dissolves. And gravel is just a calculus, broken into minute pieces by. When that moves downwards, it exits with the urine. When it moves upwards, it becomes obstructed. In those who suppress urine, vata, having obstructed the mouth of the bladder, causes urinary retention, pain, itching, and sometimes, due to its own nature, displaces the bladder, making it everted, resembling a fetus, swollen, and prolapsed. There it causes pain, burning, throbbing, and twisting sensations. Urine is discharged in drops, and when the bladder is pressed, it flows in a stream. This twofold condition is known as. The first is difficult to cure, and the second, due to strong vata, is even more difficult to cure. Vata, having settled between the path of feces and the bladder, forms a dense, immobile, elevated lump resembling a stone of a fruit. This is called, and it causes distension and retention of feces, urine, and flitus. The deranged vata, having become coiled in the bladder with severe pain, twists the urine and wanders about, accompanied by stiffness, twisting, and heaviness. It discharges urine in very small amounts, or along with feces. This is called urine when retained for a long time, does not come out, or comes out obstructed. That is excessive urination with little pain. When urine obstructed by retention is forced upwards by wind, it then fills the abdomen below the navel. It causes severe pain, distension, indigestion, and accumulation of feces. That is urinary tumor, or due to a defect in the opening, or by wind. A small amount of urine, when expelled, remains in the bladder or in the urethra, or in the glans penis, and then slowly trickles out, either with pain or without pain. That is urinary retention. characterized by an interrupted flow and a heavy remaining penis. A round, firm, small lump suddenly appears inside the mouth of the bladder. This lump, causing pain similar to a urinary calculus, is called urinary tumor. When a man who has urinated engages in sexual intercourse, the semen, agitated by wind, becomes dislodged from its place and is expelled either before or after urination. This semen, resembling ash water, is called urinary semen. When feces due to an emaciated and weak individuals enters the urinary channels in an upward direction, then, mixed with feces, the urine becomes foul-smelling like feces. This condition is known as fecal obstruction. When one of the three, aggravated by exertion, pungent and hot foods, travel, sun exposure, etc., and propelled by one of the three, causes pain and burning in the bladder and genitals, and discharges urine that is yellow or mixed with blood or blood alone, hot repeatedly and with difficulty, then they call it hot. In a person who is emaciated and whose body is exhausted, and another name for located in the bladder, cause a decrease in urine accompanied by pain and burning. This is called urinary depletion. If and one of the three, or both, are obstructed by another name for, then urine is discharged with difficulty, yellow, red, white, or thick. It may also be hot and the color of ox gall or conch shell powder. When dry, or of all colors, they call it urinary sediment. Thus, the diseases arising from non-emission of urine have been extensively described. Hereafter, the diseases arising from excessive emission of urine will be described with their causes and symptoms. Thus, in the composed by the illustrious Vagbhata, son of the Lord of Physicians Simhagupta, in the third section, Nidana Sthana, the 9th chapter named Mutragata Nidana is concluded. Chapter 10. Now we shall expound the etiology of urinary disorders. Thus said the great sages Atreya and others. There are 20, 10 from Kapha, 6 from and 4 from Vata. Of these, that which predominantly causes fat urine and is born from food, drink, and activities is their causative factor. Sweet, sour, salty, unctuous, heavy, slimy, cold, new grains, liquor, meat from marshy lands, sugarcane products, jaggery milk products. Delight in remaining in one place and sitting, and improper sleeping. The having been vitiated creates by resorting to the bladder. After vitiating the body's moisture, sweat, fat, plasma, and muscle tissue. When one of the three doses and other tissues are diminished, one of the three doses and blood, also residing in the urine, cause, i.e., having brought the tissues to the bladder, also causes even when they are diminished. The urinary disorders that arise from that cause are curable, manageable, or incurable due to the similarity or dissimilarity of treatment, and also due to their great danger. The general characteristic of these pramehas is abundant and turbid urination. Now, since the such as and the such as the bodies are similar, how can there be a multiplicity of for each? To this, he says, even though there is no distinction in the and due to the specific nature of their combination, a distinction in the is conceived based on differences in the color of the urine and so forth. One urinates clear, abundant, cold, odorless, water-like urine, and it is slightly turbid and slimy. The patient with sugarcane diabetes passes urine that is exceedingly sweet like the juice of sugarcane. The urine of dense diabetes becomes dense when left overnight. The patient with alcohol-like diabetes passes urine resembling alcohol, clear on top and dense below. One whose hair stands on end passes urine thick like flour, white and resembling flour. One suffering from semen urine diabetes passes urine resembling semen or mixed with semen. One suffering from sand urine diabetes passes solid, minute impurities resembling sand. The one with cold passes urine that is very abundant, sweet, and extremely cold. The one who urinates slowly passes urine very slowly. In slimy, the urine is slimy, mixed with threads of saliva. By smell, color, taste, and touch, like alkaline water by alkali. By blue urine, it is bluish. The patient with black urine passes urine resembling ink. In a type of urinary disorder, the urine is pungent, similar to turmeric, and causes a burning sensation. In a type of urinary disorder, the urine is foul-smelling and resembles water mixed with Indian matter. For one suffering from a type of urinary disorder, the urine is foul-smelling, hot, salty, and reddish. The one suffering from repeatedly urinates, muscle fat, or urine mixed with or itself. The one suffering from repeatedly urinates, bone marrow, or urine mixed with. The one suffering from urinates constantly like an intoxicated elephant, urine that is devoid of force, mixed with lymph and obstructed. One afflicted with passes urine like honey. It is said to be of two kinds, when is aggravated due to the depletion of or when its channels are obstructed by. When obstructed, it exhibits the signs of without cause. Being depleted one moment and full the next, it becomes difficult to cure. Because all urinary disorders, if neglected over time, turn into diabetes mellitus. And because in all of them, the urine is sweet, like honey. Therefore, all are called due to the sweetness of the body. Indigestion, anorexia, vomiting, sleepiness, cough with rhinitis, these are the complications that arise in born of. Pricking pain in the bladder and penis, tearing pain in the testicles, fever, burning sensation, thirst, sour eructations, fainting, and loose stools are for those born of. In those with predominance, upward, movement of vata, trembling, gripping pain in the heart, and restlessness occur. Pain, sleeplessness, emaciation, cough, and dyspnea also arise. And these are the 10 carbuncles boils that arise from neglecting urinary disorders. They occur in the joints, vital spots, and fleshy regions. That is raised at the edges, depressed in the center, blackish, accompanied by discharge and pain, and resembles the shape of a saucer is called. It has deep pain and pricking and a large base. Smooth, resembling a tortoise's back, such a pustule is considered A. Stiff, covered with a network of veins with an unctuous discharge and a large cavity, full of pain and pricking, and with minute pores. This is the. With deep pain and exudation, located on the back or in the abdomen. A large, blue, and depressed is known as. When it arises, it burns the skin intensely, is very painful, and spreads. This is a spreading eruption. It is reddish-black, accompanied by extreme thirst, blisters, burning, delusion, and fever. This is a type of carbuncle. The smallpox is similar to a lentil in size and appearance. The type of boil is similar to a mustard seed in size and appearance, ripens quickly, and causes great pain. It is surrounded by pustules resembling mustard seeds. The type of boil is large and covered with many very small pustules. The type of boil is round like the root of Indian kudzu and hard. The abscess will be described elsewhere. Among them, the first 3, carbuncles, and are difficult to treat for those with abundant fat. The others, which are dominant, are treatable and occur in those with little. In these, the predominance of occurs appropriately according to the type of urinary disorder. Even without diabetes, urinary disorders, these arise from vitiated, and they are not observed until the sight is affected. One who urinates yellow or red, but without the premonitory symptoms of urinary disorders. That is not known as. Rather, they know it to be a disorder of blood and bile. Sweating, body odor, looseness of the limbs, excessive inclination to sleep, sit, and lie down. Coating of the heart, eyes, tongue, and ears, heaviness of the body, excessive growth of hair and nails, fondness for cold things, dryness of the throat and palate, sweetness in the mouth, burning sensation in the hands and feet. And ants swarming to the urine. These are the premonitory symptoms of the impending group of S. Upon seeing urinary disorder that is sweet, slimy, and honey-like, there are 2 types of considerations. Is it caused by due to overnourishment, or is it dominant when the S are depleted? And S that are accompanied by premonitory symptoms, and those S caused by in sequence are incurable. Those caused by are manageable, and they become curable if the fat tissue is not excessively vitiated. Thus ends the 10th chapter, named in the 3rd section of the Ashtanga Hridaya Samhita, composed by the illustrious Vagbhata, son of the Lord of Physicians Simhagupta. Chapter 11. Now we shall expound the etiology of abscess, scrotal enlargement, and abdominal tumor. Thus indeed said the great sages Atreya and others. Due to consuming stale, excessively hot, dry, desiccated, and pitta-aggravating foods, due to improper postures in bed and improper movements, and due to various other factors that vitiate the blood and swelling that is located in vitiated skin, muscle, fat, bone, ligaments, tendons, blood, or large tendons, which is external or internal, has a deep root and causes great pain, which may be circular or elongated, is known as of 6 types. These types arise from individual bodily humors, from a combination of from blood and from injury. Among these, the external one, located in various parts of the body, is hard, nodular, and elevated. The internal one is even harder, deep-seated, dense like a, rising up like an anthill, and rapidly destructive like fire and a weapon. It may occur in the navel, bladder, liver, spleen, pancreas, right lung, heart, abdomen, groin, in the kidneys, and in the anus. Due to one of the three, there is extremely severe pain. It is blackish red, slow to appear and mature, and irregularly shaped. It is accompanied by pricking, cutting, wandering pain, distension, throbbing, creeping sensation, and a sound. It is reddish coppery or blackish due to accompanied by thirst, delusion, fever, and burning sensation. It appears and matures quickly. It is pale and itchy due to. It is accompanied by nausea, coldness, stiffness, yawning, anorexia, and heaviness. It is slow to appear and mature, is mixed due to simultaneous vitiation of all three. And here, by implication, one should distinguish between the external and internal characteristics. An external caused by blood is covered with black pustules, is dark, and has intense burning, pain, and fever. It has the symptoms of one of the three and is external only in men. Similarly, an internal caused by blood occurs only in women, due to injury from weapons, etc., or in a wound of one who indulges in unwholesome activities. The heat of the wound, agitated by one of the three expelling one of the three, along with blood, causes a abscess with the symptoms of and blood and many complications. In the navel, hiccups occurs. In the bladder, urine is foul and passed with difficulty. In the liver, dyspnea. In the spleen, obstruction of exhalation. Then thirst and choking sensation in the lungs, trachea, stiffness of all limbs in the heart. Delusion, a type of dyspnea, cough, throbbing, and pain in the heart. Pain in the abdomen, sides, and between the shoulders, and distension arising in the abdomen. Stiffness of the thighs and groins, in the kidneys, loins, and back. Pain in the sides, and obstruction of flatus in the anus. Their unripe, ripe, and overripe states should be described like those of swellings. Those that have ripened above the navel discharge from the mouth, those below from the anus. The one originating in the navel discharges from the anus and mouth. One should know from the moisture exudation in abscess, just as in an ulcer. Among these, the cause by all three is to be avoided. An abscess that is mature, located in the heart, navel, or bladder, and has burst either internally or externally. And one that is mature, discharging internally through an orifice, and accompanied by complications in an emaciated person, is to be avoided. In the same way, when the opened mammary ducts of women who have recently delivered or are pregnant are affected, a dense swelling may arise in the breast, whether it contains milk or not, exhibiting the characteristics of an external. It does not occur in virgins because their ducts have narrow openings. Thus ends the chapter on the etiology of. Now, the etiology of hernia scrotal enlargement. When one of the three, aggravated and with its movement obstructed, moves about, causing swelling and pain, and reaches the scrotum from the groin. It presses the arteries that carry blood to the scrotal sacs and causes enlargement of the scrotal sacs. That disease is of 7 types caused by id, blood, fat, urine, and intestines. The urinary and intestinal types are also due to vayu, the difference being merely in the cause. From it has a touch like a bladder filled with air, is rough, and causes pain without any apparent reason. Due to one of the three, it resembles a ripe fig and is accompanied by burning sensation, heat, and suppuration. Due to one of the three, it is cold, heavy, unctuous, itchy, hard, and causes little pain. Due to blood, it is covered with black blisters and exhibits the signs of increase. The type hernia is caused by an increase of, and fat is soft and resembles a fruit, palmyra, palm fruit. The urinary type, occurring in one who habitually suppresses urine when walking, it shakes like a bladder full of water, is painful and soft. There is also dysuria and a ring-like swelling below the scrotum and testicles. Due to foods that aggravate bathing in cold water, suppression of urges, exertion, carrying heavy loads, long journeys, and abnormal bodily movements, that wind, when pressed internally, makes a sound and moves, and when released, it expands and returns again. This intestinal hernia is incurable and resembles a type. Thus ends the chapter on the Nidana etiology of. Now, the etiology of abdominal tumor is 8-fold, characterized by rough, black, and reddish veins, a network of tendons, and appearing like a window. It arises from the individual, from their combination, and from their accumulation. The 8th type occurs in women due to a disorder of the menstrual blood, a person emaciated by fever, vomiting, diarrhea, etc. or by therapeutic actions like emesis, etc., who consumes aggravating foods, or, being hungry, drinks cold water, and then immediately after meals engages in fasting, swimming, etc., which agitate the body or induces vomiting. When it is not yet ready or suppresses urges for flatus, etc., when they are ready or undergoes purification therapy without prior oleation and sudation, or having been purified, immediately consumes foods that cause burning sensation or are liquefying. In such a person, the waste products, predominantly either individually or in pairs, or all together, or combined with blood residing in the great channels, obstruct the upward and downward pathways and produce a palpable, elevated, tumor-like mass called preceded by pain. Due to emaciation, or due to obstruction of the channels by feces, and having taken residence in the abdomen, attains hardness due to its dryness. It is independent when vitiated in its own site, and dependent when vitiated in another's site. Though formless due to its aggregation, it appears to have assumed a form. This is called residing in the bladder, navel, heart, and flanks. Due to one of the three, there is pain in the nape of the neck and head, fever, splenic enlargement, gurgling in the intestines, a pricking sensation as if by a needle, constipation, frequent difficult breathing, stiffness in the body, dryness in the mouth, emaciation, irregular digestive fire, and a rough, blackish appearance of the skin and other tissues due to the mobility of vata. An abdominal lump has an indeterminate shape, location, growth, diminution, and pain. It throbs and feels as if covered by ants. Due to one of the three, there is burning sensation, sour eructations, fainting, diarrhea, sweating, thirst, and fever. There is a yellowish discoloration of the skin and other tissues, and the is intolerant to touch. It causes distress, feels intensely hot, is accompanied by heat, and seems to burn its own location. Due to one of the three, there is a feeling of wetness, coldness, anorexia, debility, fever with chills, rhinitis, lethargy, nausea, cough, and a whitish appearance of the skin and other tissues. The is deeply seated, hard, heavy, numb, stable, and causes little pain, whose own humor is in its own location and abode, and which cause pain at their own specific times. Mostly, the three arising from two exhibit mixed symptoms. The one caused by all has severe pain and burning, ripens quickly, is dense and elevated. That is incurable. If a woman, either during her menstrual period or recently delivered, or suffering from a vaginal disease, consumes aggravating foods, then her vata becomes aggravated. It obstructs the menstrual blood that is present in the vagina each month. That then causes an abdominal mass and manifests the signs of pregnancy, such as nausea, cravings, appearance of breast milk, emaciation, etc. Gradually, due to association with wind and its originating nature, that blood causes in her the complications arising from, such as pain, stiffness, burning, diarrhea, thirst, fever, etc., and especially severe pain in the uterus, which is the abode of vitiated blood, and vaginal discharge, foul odor, pricking pain, throbbing, and pain. Abdominal tumor does not pulsate with limbs like a fetus, but it is painful. That very same having become a mass sometimes pulsates in her after a long time. Her abdomen does not enlarge, but only the itself enlarges. Every has its own as its substratum, therefore it undergoes suppuration slowly or not at all, whereas an abscess suppurates very quickly because it is based on vitiated blood. Therefore, due to its rapid suppuration, it is called. When the is internal, there are pains in the bladder, abdomen, heart, and spleen, loss of digestive fire, strength and complexion, and non-initiation of urges. The opposite occurs when it is external. There is not excessive pain in the organs of the trunk. There is discoloration of the affected area and greater external prominence. Thus ends the chapter on the Nidana of Gulma. Due to the obstruction of wind, both upwards and downwards, there is severe distension in the abdomen, accompanied by rumbling and extremely severe pain. This is called a dense, stone-like mass that is elevated upwards from the prostate region and has the characteristics of, is called. If it is transverse and has a similar shape, it is. When wind moves from the large intestine to the anus and genitals with severe pain, it is the same when it moves in the opposite direction. They declare these to be the signs of an impending abdominal tumor. Thus, in the composed by the illustrious Vagbhata, son of the Lord of Physicians Simagupta, in the 3rd section, Nidana Sthana, ends the 11th chapter, named Vidradhi Vrdhi Gulmanidana, diagnosis of abscess, scrotal enlargement, and abdominal tumor. Chapter 12. Now we shall expound the etiology of abdominal diseases. Thus indeed spoke the great sages like Atreya. All diseases, especially diseases, arise when the digestive fire is weak. They are caused by indigestion, by impure foods, and by the accumulation of waste products. The bodily tissue's constituents, obstructing the channels carrying water upwards and downwards, vitiate the and become located in the junction of the skin and flesh. They distend the abdomen and cause, and that is divided into 8 types. Those caused by individual by all combined, and by spleen enlargement, obstruction, injury, and water ascites. Afflicted by that, men have dry palates and lips, swollen feet, hands, and abdomen, lost activity, strength, and appetite, are emaciated, and have distended bellies. They become like ghosts. The symptoms of its impending onset are loss of appetite. All food is digested slowly and with a burning sensation. One does not know if food is digested or undigested, and does not tolerate satiety. One's strength constantly wanes, and one breathes heavily even with slight exertion. There is an increase in feces, non-elimination, and slight swelling of the feet. There is pain in the bladder joint and distension, even with light, little, or no food. The appearance of lines and disappearance of wrinkles on the abdomen. In all types of abdominal diseases, there is drowsiness, debility, constipation, low digestive fire, burning sensation, swelling, distension, and finally, the accumulation of water. The entire abdomen is without water, reddish, without swelling, not very heavy. It is marked by a network of veins and always gurgles. The wind obstructs the navel and intestines, and after causing a paroxysm, it disappears. There are pains in the heart, waist, navel, anus, and groin. The wind moves out with a sound, the feces are constipated, and the urine is scanty. The digestive fire is not very slow, there is no craving, and the mouth is not tasteless. In abdominal disease due to, there is swelling in the hands, feet, scrotum, and flanks. Pain in the flanks, sides, abdomen, waist, and back, and splitting pain in the joints. Dry cough, body ache, heaviness in the lower body, and retention of feces. The skin, etc., is dark reddish, and there is sudden increase and decrease in abdominal size. The abdomen is marked by pricking and tearing pain, covered with thin black veins. When struck, it makes a sound like an inflated leather bag, and in this condition, the wind moves about with pain and sound, having a pervasive movement. In abdominal disease due to, there is fever, fainting, burning sensation, thirst, and a pungent taste in the mouth, dizziness, diarrhea, yellowness in the skin, etc., and the abdomen is greenish. It is covered with yellow copper-colored veins, sweaty, hot, and burns. It emits smoke, is soft to the touch, quickly ripens, and causes severe pain. In abdominal dropsy due to, there is debility of the limbs, numbness, swelling, heaviness, sleepiness, nausea, anorexia, dyspnea, cough, and whiteness of the skin, etc. The abdomen is immobile, smooth, covered with white streaks, large, slowly growing, hard, cold to the touch, heavy, and firm. The waste products accumulated with blood by various factors that provoke all 3 by menstrual impurities given by women, and by artificial poison, latent poison, etc., reaching the abdominal cavity and undergoing perversion, cause an abdominal disease with the characteristics of all 3 accompanied by emaciation, fainting, and giddiness, which is rapidly progressing and extremely severe. That abdominal disease especially afflicts one upon seeing cold, wind, and clouds, due to agitation from excessive eating and from activities like riding vehicles, excessive sexual activity, exertion, long journeys, vomiting, and debilitating diseases. The spleen, situated in the left side, becomes dislodged from its place and enlarges, or blood increased from plasma, etc., may enlarge it. That spleen is initially as hard as a stone, then like a tortoise's back, and gradually increasing, it causes abdominal dropsy in the abdomen. It is accompanied by dyspnea, cough, thirst, foul taste in the mouth, flatulence, pain, fever, pallor, fainting, vomiting, burning sensation, and delusion. It is reddish, discolored, or marked with blue and yellowish streaks. One should know the waste products in splenic enlargement by pain from upward movement of distension, delusion, thirst, burning sensation, fever, heaviness, anorexia, and hardness in sequence. Similarly, the liver, when dislodged from the right side, causes conditions like those of the spleen. when the downward moving becomes aggravated, having consumed eyelashes and hairs along with food, and when the anus has its passages obstructed, or by hemorrhoids, or by upward movement of, or by other substances that adhere to the intestines. It obstructs feces and causes abdominal disease. Due to this, there are burning sensation, fever, thirst, sneezing, cough, dyspnea, weakness in the thighs, pain in the head, heart, navel, and anus. Retention of waste products, anorexia, vomiting, and abdominal enlargement with obstructed wind. It is firm, covered with blue and reddish veins or without veins, and it mostly appears above the navel, shaped like a cow's tail. When the intestine is pierced or suppurates by foreign bodies, such as bones, or by food consumed with them, or by overeating, and through those perforations, undigested material mixed with fecal fluid flows out from the anus in small quantities, resembling the smell of a corpse, slimy and yellowish red. The remaining fluid filling the abdomen causes a terrible abdominal disease. This abdomen increases below the navel and quickly takes on a watery nature. It is characterized by aggravated and is accompanied by dyspnea, thirst, and dizziness. This is called perforated abdomen by some and exuding by others. In a person who has undergone oleation therapy, etc., and suddenly drinks unboiled water, or in one with weak digestion, or who is emaciated or extremely thin due to excessive water intake, vata, and obstructed in the water channels and mixed with water, increase that very water, having moved from their usual place to reside in the abdomen. Then the abdomen becomes afflicted with thirst, anal discharge, and pain, accompanied by cough, dyspnea, and anorexia, and covered with various colored veins. It feels like a water-filled leather bag when touched, makes a splashing sound, and trembles. This, ascites, is large, unctuous, firm, and has an inverted navel. Due to neglect in all types of abdominal diseases, the humors, displaced from their own seats, become liquid due to maturation, inflammation, and liquefy even the openings of the joints and channels. And sweat, being obstructed in the external channels and moving obliquely, then causes that very water to swell and become slimy. Then the abdomen becomes heavy, firm, round, and when struck, it does not produce a sound. It is soft, devoid of visible veins, and when touched at the navel, it spreads. Subsequently, in this condition, water accumulates, and then the abdominal enlargement becomes even greater. The disappearance of veins and the symptoms described for watery abdomen are also present. The splenic enlargement, all three combined, and ascites, types of abdominal diseases, become progressively more difficult to cure. The other two types, obstruction and injury-induced, generally kill the patient after a fortnight. And any abdominal disease where fluid has accumulated, or which is accompanied by symptoms described in the chapter. All types of abdominal diseases are generally considered most difficult from their very origin. However, if it occurs in a strong person, is newly arisen, and has not yet developed fluid, it is curable with effort. Thus concludes the 12th chapter, named Diagnosis of Abdominal Diseases, in the 3rd section on diagnosis of the Ashtanga Hridaya Samhita, composed by the illustrious Vagbhata, son of the Lord of Physicians, Simhagupta. Chapter 13. Now we shall explain the etiology of anemia, chlorosis, oedema, and erysipelas. Thus spoke the great sages, Atreya and others. The dosas predominantly become aggravated by the aforementioned aggravating factors. There, situated in the heart, is propelled by strong vata. Reaching the 10 arteries channels, it pervades the entire body. Having vitiated kapha, skin, blood, and muscle, and having lodged itself internally, it produces various colors on the skin, between the skin and muscles. These are pale, yellowish, and green, with paleness being most predominant among them. Because of this, that disease is called pale. By that, there is heaviness of the and looseness, and a diminution of the qualities of. Then, the person has little blood and fat, is weak, and has lax senses. His limbs feel as if being crushed, and there is a melting sensation in the heart. His eye sockets are swollen. He has lassitude, is irritable, spits, speaks little, dislikes food, hates cold, has falling hair, diminished digestive fire, weak thighs, fever, dyspnea, ringing in the ears, dizziness, and fatigue. It is of 5 types, caused by individual, by all of them combined, and by eating clay. The premonitory symptoms of this disease are palpitation of the heart, dryness of the skin, anorexia, yellow urine, absence of sweating, diminished digestive fire, debility, fatigue, due to vata dose. There is body pain and tremors. The veins, nails, feces, urine, and eyes are black, dry, and reddish. There is swelling, abdominal distension, tastelessness in the mouth, dry stools, and pain in the sides and head. Due to the veins and so forth are greenish yellow. There is fever, darkness of vision, thirst, sweating, fainting, desire for cold, foul odor, bitter taste in the mouth, loose stools, sour eructations, burning sensation, due to one of the three. There is whiteness of the veins, etc. Drowsiness, a salty taste in the mouth, horripilation, loss of voice, cough, and vomiting. Due to accumulation, it has mixed symptoms and is extremely difficult to bear. Earth that is astringent vitiates vata. Earth that is saline vitiates. And earth that is sweet vitiates. Having vitiated plasma and other bodily tissues, and having dried up the ingested food due to its dryness, and having filled and obstructed the channels, while still undigested, it causes anemia chlorosis, as before. Then, a person afflicted with will have swelling of the navel, feet, face, and penis, and will pass stool mixed with worms broken and containing blood and, if a person suffering from anemia chlorosis consumes pitta-aggravating substances, then jaundice will arise for him. The one of the three doses, having burnt the blood and muscle, will bring about residing in the alimentary tract and peripheral tissues. With the eyes, urine, skin, nails, mouth, and feces becoming yellowish-green, the person experiences burning sensation, indigestion, thirst, appears like a frog, and has weakened senses. Does occur only in a who consumes substances or also in one who is nada. He says, this Kamala can also occur in a person with an excess of even without. And when that, due to neglect, becomes abundant with swelling edema, it is called which is difficult to cure. When in there is a greenish, bluish-black, and yellowish discoloration, along with giddiness, thirst, lack of sexual desire, mild fever, drowsiness, loss of strength, and digestive fire, then that condition is called, and thus they declare. Among these, the complications were previously said to be predominantly swelling. Therefore, that very is now described. Now, the etiology of carrying vitiated blood and into the external channels, and having its movement obstructed by them, creates a compact swelling located in the skin and flesh. This is called because of its accumulation. Thus ends the of anemia. But due to specific causes and differences in manifestation, it is said to be of 9 types, caused by individual, by pairs of, by all, by trauma, and by poison. Or it is of 2 types, endogenous and exogenous. That is also known to be of 3 types based on the distinctions of being broad elevated or indurated, whether it affects the whole body or a single limb. The general cause of swelling, especially those of origin, is for one weakened by disease, therapeutic procedures, fasting, etc., who quickly, or for another excessively consumes heavy, sour, unctuous, cold, salty, alkaline, pungent, hot, leafy vegetables, water, sleeps during the day, stays awake at night, consumes mud, meat of domesticated animals, dried meat, suffers from indigestion, exertion, sexual activity, walks long distances on foot, or travels in a jolting vehicle. Also, dyspnea, cough, diarrhea, piles, abdominal diseases, menorrhagia, fever, cholera, intestinal inertia, vomiting, pregnancy, erysipelas, anemia, and other diseases that are improperly treated. By these, the located in the chest cause swelling upwards, those located in the bladder cause swelling downwards, those in the middle cause swelling in the middle. Those spread throughout the entire body cause generalized swelling, those localized in specific limbs cause swelling in those limbs. Its premonitory symptoms are a burning sensation, distension of vessels, and heaviness of the body. A due to is mobile, dry, rough-haired, reddish-brown or black, accompanied by contraction, throbbing, horripilation, pain, pricking, tearing, and numbness. It arises and subsides quickly. When pressed, it quickly rises again and is thin. It subsides with unctuous and hot applications and massage. It is slight at night and great during the day. The skin, as if smeared with mustard, also tingles in it. The swelling due to one of the 3 is yellow, red, or blackish in appearance, and causes coppery red hair. It quickly spreads and subsides and is thin in the middle, appearing first there. It is accompanied by thirst, burning sensation, fever, sweating, oozing, intoxication, and dizziness. The patient desires cold, has loose stools, a foul odor, is intolerant to touch, and is soft. The swelling due to one of the 3 is itchy, pale, has stiff skin, is cold and heavy. It is unctuous, smooth, stable, firm, and causes sleepiness, vomiting, and dullness of digestive fire. When pressed, it does not rise up. Its alleviation and origin are difficult. It is stronger at night. When injured by grass, a weapon, etc., it does not bleed quickly, but oozes a sticky discharge after a long time. It desires warm touch, and the three swellings are according to their respective combinations. Due to the combination of causes and symptoms, is of the nature of an accumulation of, due to injury from weapons, etc., such as cutting, piercing, or wounding, due to contact with snow, wind, sea breeze, marking nut and cow-age plants, and their saps and bristles. A swelling arises that is accompanied by erysipelas. It is intensely hot, reddish in appearance, and predominantly exhibits the characteristics of one of the three. A poisonous swelling arises from the crawling and urinating of poisonous creatures on the body, and from the bites, teeth, and claw marks of even non-poisonous creatures. It also arises from contact with clothes contaminated by feces, urine, or semen, from contact with the wind, from poisonous trees, and from the application of artificial poison compounds. It is soft, mobile, pendulous, rapid in onset, and causes burning and pain. A swelling that is new and without complications is curable. The incurable type has been described before. Thus ends the chapter on the etiology of. Now, the etiology of erysipelas spreading skin disease arises from the distant and vitiated tissues, just like and also from external injuries. They declare it visarpa to have three locations, based on whether it is external, internal, or both, and those become progressively more difficult to cure. There, the bodily humors, agitated by aggravating factors, especially by those that cause burning quickly, spread throughout the body. Those located internally spread internally, those located externally spread externally, and those located in both places, internal and external, spread in both ways. One should know the internal there. From affliction of vital organs, from unconsciousness, from twitching of channels, from excessive thirst, from irregular manifestation of urges, and from rapid destruction of digestive fire and strength. The external is known by the opposite signs. There, the caused by wind dosa has pain similar to fever, characterized by swelling, throbbing, pricking pain, tearing pain, distension, and horripilation. Due to it spreads rapidly, has the symptoms of fever, and is excessively red. Due to it is itchy, unctuous, and has symptoms similar to fever. All of them, if neglected, are covered with blisters bearing the symptoms of their respective. When these mature and burst, they exhibit the characteristics of their respective ulcers. A erysipelas, caused by and is accompanied by fever, vomiting, fainting, diarrhea, thirst, dizziness, bone pain, loss of digestive fire, darkness before the eyes, and anorexia. It makes the entire body feel as if it is covered with glowing embers. Whichever part of the body the spreads to, that part becomes black like extinguished embers, blue or red, and quickly accumulates lesions. It is covered with blisters as if burnt by fire, and due to its rapid progression, it spreads quickly. This follows the vital points, and the ease is exceedingly strong in it. It causes pain in the body, takes away consciousness and sleep, and induces dyspnea and hiccup. Having reached such a state, the person afflicted by extreme restlessness finds no comfort on the ground, bed, or seat. Restless and distressed, he experiences sleep born of mental and physical fatigue, from which he awakens with difficulty. This is called fiery erysipelas. When Vata is obstructed by it, breaks that in many ways, or vitiates the blood in a person with aggravated blood, affecting the skin, veins, ligaments, and muscles. It then forms a garland of long, circular, thick, and rough, red nodules accompanied by severe pain and fever. This is associated with dyspnea, cough, diarrhea, dryness of the mouth, hiccup, vomiting, dizziness, delusion, discoloration, fainting, body aches, and loss of digestive fire. This is called nodular erysipelas, arising from the aggravation of Vata. From and arise fever, stiffness, drowsiness, stupor, headache, prostration of the limbs, twitching, delirium, anorexia, dizziness, fainting, loss of digestive fire, bone pain, thirst, heaviness of the senses, passage of undigested stool, and coating of the channels. This spreads, predominantly in the stomach, upper abdomen, affecting one part, and is not excessively painful. It is covered with very yellow, reddish, and pale pustules. It is dark blue, black, unctuous, dirty, swollen, heavy, with deep suppuration, intense heat, and when touched, it is moist and breaks apart, like mud, with flesh wasted away, and tendons and veins clearly visible. It has the smell of a corpse. That is called mud-like. The all dosa type is characterized by all symptoms and spreads excessively through all body tissues. Due to an external cause, a wound, one of the three dosas, when aggravated, expelling one of the three dosas with blood, causes erysipelas herpes, marked by eruptions resembling horse gram, accompanied by swelling fever pain and burning sensation and appearing dark red. The three types caused by individual are curable, as are the dual dosa types if they are without complications. The traumatic and all dosa types are incurable, as are all that affect vital organs, those with disintegrated tendons, vessels, and muscles, those that are excessively moist, and those that smell like a corpse are also incurable, 67.5. Thus ends the chapter on the diagnosis of. Thus ends the 13th chapter, named Panduro Gasophavasarpanidana, in the third section, Nidana Sthana, of the Ashtanga Hridaya Samhita, composed by the illustrious Vagbhata, son of Sri Vidyapati Simhagupta. Chapter 14, Ashtanga Hridaya Samhita. Now therefore we shall expound the etiology of skin diseases, leukoderma, and worms. Thus indeed spoke the great sages, Atreya and others. By improper diet and lifestyle, especially by incompatible ones, and by sinful acts such as slandering virtuous people, killing and stealing others' property, whether committed immediately or in previous lives, the waste products dosas are agitated. Entering the obliquely coursing channels, they contaminate the skin, lymph, blood, and muscle tissue. Loosening them, they then emerge outwards, causing discoloration of the skin. This, when vitiated, is called Ashtanga Hridaya Samhita, because when neglected over time, it afflicts the entire body, pervading all the tissues internally, and thoroughly moistening them, it produces minute and very terrible worms associated with sweat, moisture, and putrefaction, by which it gradually consumes the hair, skin, tendons, arteries, and soft bones. Leukoderma is said to be external to because of this. Ashtanga Hridaya Samhita is of 7 types due to the individually mixed or combined. Even though all involve all three, the designation is based on the predominant. Due to leprosy, due to, and is born of, are born of, due to and, with, and also. Due to all three occurs the first 3 with, and these 7 are the major leprosies. Excessive smoothness, roughness to the touch, absence of sweat, discoloration, burning sensation, itching, numbness in the skin, pricking pain, raised eruptions, fatigue, excessive pain in wounds, quick onset, prolonged duration, even after healing, dryness, aggravation even by a minor cause, horripilation, blackness of blood. These are the initial symptoms of leprosy. The type of is blackish red like a potsherd, rough, numb, coarse, thin, with wide and uneven edges, covered with erect hairs, full of pricking pain, with little itching, and spreads quickly. The type is coppery like a ripe fig, with hair and prominent white veins. It is thick, with abundant exudate and blood, and has severe burning and pain. It quickly arises, breaks open, and is infested with worms. One should know this as. The type is firm, congealed, heavy, unctuous, white and red, and does not spread quickly. Its lesions are stuck together, elevated, with much itching, discharge, and worms. It is a circular patch with smooth, yellowish edges. With itching, pustules, blackish, full of lymph. This is a type of skin disease. Rough, thin, red at the edges, blackish inside, elevated. With pricking pain, burning sensation, and exudation, covered with hard pustules. It is said to resemble a bear's tongue and is called bear's tongue disease, having many worms. Having a rough touch like an elephant's hide, this is a skin disease, known as single, having a large extent. Without sweat, resembling fish scales. However, is rough, has a touch like a hard scar, is itchy, coarse, and blackish. Is rough externally, unctuous internally, and when rubbed, it sheds dust. It is smooth to the touch, thin, whitish red, like the flower of bottle gourd. It mostly occurs on the upper part of the body, covered with red, itchy nodules. A type of skin disease, is red, fissures, are cracks on the hands and feet, accompanied by intense pain, mild itching, and covered with red eruptions. Ringworm. Has long extensions like grass, the color of flax flowers, raised circular patches, is itchy and persistent. The skin disease called has a thick base, constant burning pain, is reddish-black, has many ulcers, 100 sores, is abundant with moisture and worms, and mostly originates in the joints. The called has red edges, is pale in the center, accompanied by itching, burning, and pain, elevated, covered with red streaks like a lotus petal, predominantly thick, abundant lymph and blood, and quickly breaks open. The cauld is covered with thin-skinned, white and tilling, reddish blisters. Pustules with an excess of scabies, itching, exudation, and pain. They are small, dusky, reddish, and numerous, appearing mostly on the buttocks, hands, and elbows, with blisters unbearable to touch, accompanied by itching, pricking pain, and burning, red with skin that cracks. This is a type of skin disease. A type of has intense burning and pain, initially red and black, resembling the fruit of Abrus precatorius. It is endowed with all the signs of, but then it becomes multicolored. One should determine the predominance of bodily humors in skin diseases by the signs and actions prescribed in the chapter on the differentiation of. One should abandon treatment of where all are predominant, and that which is mentioned as fatal prognostic sign, and that which is located in the bone, marrow, or semen. The located in the fat is palliative. That which is associated with a combination of bile, blood, and flesh is difficult to cure. That which is predominant in and located in the skin and involves only one waste product is easy to cure. In that located in the skin, there are pricking pains, discoloration, and dryness. When in the blood, there is sweating, numbness, and swelling. When in the flesh, there are eruptions located on the hands and feet and excessive stickiness in the joints. When in the fat, there is deformity, loss of movement of the limbs, and tearing apart. When in the bone and marrow, there is collapse of the nose, redness of the eyes, and loss of voice. In a wound, there are worms. When in the semen, there is affliction of one's wife and offspring, and all the signs in the blood and other tissues should be as before. Thus ends the etiology of skin diseases. Now, the of leukoderma, which is originating from the same source as, is also known as, and severe. It is described as non-exudative and having its origin and location in the three. Due to it is dry and reddish brown. Due to it is coppery like a lotus petal, accompanied by burning sensation and causing hair loss. Due to it is white, dense, and heavy and itchy. In due order, one should describe it as being in the blood, muscle, and fat. And this leukoderma of both types, distinguished by color, becomes progressively more difficult to cure. That has hair that is not white, is not thick, is not coalesced with each other, is new, and is not caused by a burn, is curable. Otherwise, it is to be rejected. Even if it is recent, appearing on the genitals, palms, soles, and lips, is to be rejected. All diseases are mostly transmissible through contact, sharing food, bedding, etc., and especially disorders of the eyes and skin. Thus ends the chapter on the etiology of. Now, the etiology of worms are said to be of two types, based on the distinction of external and internal. According to their origin, they are of four types. They are of four types based on their origin from external impurities, blood, and feces. They are of 20 types by name. Among these, the external ones arise from dirt. They are the size, shape, and color of sesame seeds, residing in hair and clothes. They have many legs and are minute, named N. These two types cause urticaria, papules, itching, and boils. Those born internally, whose sole cause is skin disease, those born of one of the three, are more prevalent among them. They arise from sweet foods, jaggery, milk, curds, roasted grain flour, and fresh rice. And those born from feces arise from many kinds of grains, leafy vegetables, and so forth. Born in the stomach upper GI tract from one of the three when grown, they spread everywhere. Some are like broad-based pots. Some resemble earthworms. Others are shaped like sprouted grains, thin, long, and minute. They are white, coppery, or blackish-white in color, and are 7 types by name. They are gut eaters, abdomen encirclers, heart eaters, great cavity dwellers, grass flower-like, and fragrant. They cause nausea, salivation, indigestion, anorexia, fainting, vomiting, fever, abdominal distension, emaciation, sneezing, and rhinitis. The blood-borne worms are minute, originating from the blood-carrying channels. They are limbless, round, coppery, and some are invisible due to their minuteness. They are hair eaters, hair destroyers, hair islands, and fig-like. These 6, along with, have the same action as skin diseases. Those born from feces are moving downwards, when they grow and become facing towards thee. Then the eructations and exhalations of that person become following the smell of feces. They are broad, round, thin, or thick in shape, and blackish yellow, white, or black in color. These 5 worms are named and. They cause diarrhea, pain, constipation, emaciation, roughness, pallor, horripilation, dullness of digestive fire, and anal itching upon their exit. Thus, in the composed by the illustrious Vagbhata, son of the Lord of Physicians Simagupta, in the third section Nidana Sthana, the 14th chapter, named Kushtha Svitra Kriminidana, is concluded. Chapter 15. Now therefore we shall expound the etiology of diseases of. Thus indeed spoke the great sages beginning with Atreya. The undiseased and diseased wind is the sole cause of all auspicious and inauspicious events for this entire universe, and especially for the body. He is Vishvakarma, the creator of the universe, Vishvatma, the soul of the universe, Vishvarupa, of universal form, Prajapati, lord of creatures. He is the Shrasta, creator, Dada, sustainer, Vibhu, all-pervading, Vishnu, the pervader, Samharta, destroyer, Mityu, death, and Antaka, ender. Therefore, one should always strive with effort for its non-vitiation. His natural and morbid actions have been described in the knowledge of chapter. His name and abode, each fivefold, and his movement and function have been described briefly and extensively in the differentiation of chapter. Its abnormal conditions are described with their causes and symptoms in detail. Though countless, they were previously enumerated as 80. The vitiation of can occur in both ways. Now, showing that, he says, becomes vitiated by excessive indulgence in things that cause depletion of thee. Moving in empty channels, it greatly fills those very channels. Or, being powerful, it becomes obstructed by those channels that are filled with other. There, when aggravated in the large intestine, causes pain, distension, intestinal gurgling, obstruction of feces, calculi, hernia, piles, stiffness of the sacrum, back, and waist, and various other difficult ailments in the lower body. In the stomach, thirst, vomiting, dyspnea, cough, cholera-like illness, obstruction of the throat, eructations, and diseases above the navel, destruction of the senses in the ears, etc. In the skin, cracking and dryness. When in the blood, the aggravated causes severe pain, numbness, heat, redness, discoloration, eruptions, obstruction of food, aversion to food, emaciation, and vertigo. When located in the muscle tissue and fat tissue, it causes tumors that are painful, firm, and rough, fatigue, heaviness of the limbs, extreme pain, stiffness, and a sensation as if struck by a fist or a stick. When located in the bone tissue, severe pain in the thighs, joints, and bones, and loss of strength. When located in the marrow, the aggravated causes porosity in the bones, sleeplessness, and continuous pain. When located in the semen, it causes premature ejaculation of semen, retention, or indeed its vitiation. Similarly, when located in the semen, it affects the fetus, distension and emptiness in the veins. When located there, residing in the tendons, it causes the wind dosa, located in the joints, causes swelling with a touch like a bladder full of wind, and painful movement in extension and flexion. When located throughout the entire body, it causes pricking pain, splitting pain, throbbing, breaking pain, stiffness, convulsions, numbness, joint contraction, and trembling. When the enraged repeatedly enters all the channels, then it causes the body to convulse. This disease is known as convulsions. When obstructed below, moves upwards and enters the channels located in the heart, afflicting the heart, head, and temples. It causes the body to convulse all around and bends it like a bow. The person breathes with difficulty, is stiff, has drooping and closed eyes, coos like a pigeon, and is unconscious. The same is called. When the vata is released from the heart, one repeatedly attains comfort. When it is afflicted, one repeatedly experiences discomfort. That which arises from miscarriage, that which arises from excessive bleeding, and that which arises from injury, indeed, that is the most difficult to treat. When one of the three, having seized the two vessels located in the neck and sides, obstructs them from within and then pervades the entire body, the collarbone becomes stiff. The body becomes like an inward bent bow, and with its urges, it causes stiffness in the eyes, yawning, grinding of teeth, vomiting of phlegm, pain in the sides, and gripping stiffness of speech, jaw, back, and head. This is called internal tetanus. External tetanus is of a similar kind. Due to the external bending of the body, the head is drawn backward, the chest is raised, and the neck is crushed. There is discoloration in the teeth and mouth, sweating, and flaccidity of the limbs. Is also called bow-like stiffness, and is considered to have urges. when they reach a wound located in a vital point due to the agitation of Vata. They cause the entire body, from foot to head, to become stiff. This tetanus due to a wound is to be avoided in a person who is thirsty and has a pale body. When the impetus attack has passed, there is health in all types of convulsions. Due to excessive scraping of the tongue, eating dry food, or injury, the Vata dosa, aggravated and situated at the root of the jaw, dislocates the jaws, causing either an open mouth or a closed mouth. This is called jaw dislocation, and due to it, chewing and speaking become difficult. The Vata dosa, situated in the channels that carry speech, stiffens the tongue. This is tongue stiffness, and due to it, there is inability in matters of food, drink, and speech. Due to carrying heavy loads on the head, excessive laughter and speech, being startled, sneezing, pulling a stiff bow, sleeping on an uneven pillow, and chewing hard things, one of the three dosas, becomes aggravated. Situated upwards due to these and other Vayu aggravating factors, it distorts half of the face as well as speech, laughter, and gaze. Then his head trembles. There is speech impediment, stiffness of the eyes, loosening of teeth, hoarseness of voice, loss of hearing, inability to sneeze, inability to perceive smells, confusion of memory, and terror when asleep. Saliva may flow to one side, and one eye may close. There is severe pain above the collarbone or in the lower half of the body. Some call this facial paralysis, while others call it a type of tetanus. When Vayu afflicts the blood, it makes the veins in the head rough, painful, and black. This is called seizure of veins and is incurable. Seizing half of the body and drying up the veins and ligaments destroys one side, loosening the joint bonds. The entire half of his body becomes dysfunctional and senseless. Some call this monoplegia, while others know it as hemiplegia. Similarly, when Vata pervades the entire body, it causes disease affecting all limbs. A hemiplegia caused by pure is considered extremely difficult to cure. If it is associated with another, it is difficult to cure, but if it is caused by depletion, it should be rejected as incurable. Vata, accompanied by and with its channels obstructed by undigested material, stiffens the body and causes a type of Vata disorder, which is incurable, rendering all movements destroyed, like a stick. When one of the three, located at the root of the shoulder, contracts the channels situated there, it produces which deprives the arm of movement. The tendon that extends from the back of the arm towards the palm of the fingers, and which deprives the arm of its movements, is known as. When located in the waist contracts the of one thigh, then the person becomes lame. If it contracts the of both thighs, he becomes paraplegic. One who trembles at the start of walking and walks as if limping should be known as having a type of lameness with the binding of the joints loosened. When undigested food matter excessively accumulated, along with phlegm, fat, and wind, having overcome the other, pitta, reaches the thighs. Due to the consumption of cold, hot, dry, heavy, and unctuous substances, and also due to food that is partly digested and partly undigested, and due to exertion, agitation, sleep, and wakefulness. Then that being immobile dense fills the bones within the thighs, and then it obstructs the thighs, making them stiff, cold, and devoid of sensation. They become heavy as if belonging to another and are afflicted with severe pain, accompanied by mental distress, body aches, stiffness, drowsiness, vomiting, anorexia, and fever, along with weakness of the feet, difficulty in lifting them, and numbness. This is called thigh stiffness, while others call it rich man's Vata. A swelling arising from and blood in the middle of the knee, causing great pain, should be known as jackal's head, and it is thick like a jackal's head. When pain arises in the foot due to an uneven step or from exertion, and one of the three afflicts the ankle, that condition is called a type of disorder. When the tendon of the toes, extending towards the heel, is afflicted by another name for, and it obstructs the lifting of the thigh, that condition is called sciatica, and have been described. When they are accompanied by severe pain, they are called. When a person's feet tingle and become as if asleep, that is known as caused by the aggravation of and Vata. When Vata, combined with an blood, causes burning in the feet. Especially when walking, one should diagnose that as burning feet. 56.5. Thus, in the composed by Srimad Vagbhata, son of Sri Vidyapati Simhagupta, the 15th chapter, named Diagnosis of Vata Disorders, in the 3rd section, Section on diagnostics is concluded. Chapter 16. Ashtanga Hridaya Samhita. Now, therefore, we shall expound the etiology of gout. Thus indeed did the great sages Atreya and others declare. For those who consume indigestible food, incompatible food, and other things that vitiate the blood, and who indulge in sleep, wakefulness, and sexual intercourse in an improper manner, especially those who are delicate and accustomed to little movement, when the blood of people is vitiated due to injury or improper purification. One of the three, aggravated by increasing in cold substances, becomes enraged and moves in abnormal channels. Obstructed by similarly vitiated blood, it then further vitiates that very blood. This condition is called, or by various names, Ashtanga Hridaya Samhita, and that first rushes to the feet, especially due to riding vehicles and other activities, the hanging limbs. Ashtanga Hridaya Samhita. Its symptoms. The impending disease has symptoms similar to leprosy, as well as lassitude and looseness of the limbs. In the joints of the knees, shanks, thighs, hips, shoulders, hands, and feet, itching, throbbing, pricking pain, tearing pain, heaviness, and numbness appear and disappear repeatedly and manifest again and again, having taken root in the feet and sometimes even in the hands. It spreads throughout the entire body like the enraged poison of a mouse. The gout that is superficial, residing in the skin and muscle, arises first. After some time, it becomes deep and afflicts all the tissues. In the superficial form, the skin is associated with itching and other symptoms. It is coppery, dark, and reddish. It is accompanied by distension, intense burning, and heat. In the deep form, there is swelling with more severe premonitory symptoms. The swelling is nodular and suppurative. The wind dosa, moving vigorously within the joints, bones, and bone marrow as if tearing them, causes lameness or paralysis as it moves throughout the body, making it crooked. When one of the three is excessive, there is increased pain, throbbing, and pricking. The swelling becomes rough, blackish, dark, and its increase and decrease are variable. There is contraction of the arteries, fingers, and joints, stiffness of the limbs, excessive pain, aversion to cold, non-alleviation, rigidity, trembling, and numbness. In vitiated blood, the swelling is excessively painful and pricking, coppery, and tingles. It does not subside with unctuous or dry applications and is accompanied by itching and stickiness. In vitiated one of the three, there is burning sensation, delusion, sweating, fainting, intoxication, and thirst. There is intolerance to touch, pain, redness, swelling, suppuration, and intense heat. In one of the three, there is stiffness, heaviness, numbness, unctuousness, coldness, itching, and mild pain, and signs of dualities, and all in a mixture. That which is associated with a single and is new is curable. That which arises from two is manageable. One should abandon that which arises from three, which is discharging, stiff, or produces tumors. Having quickly obstructed the blood channels, one of the three settles in the branches and joints, and by mutually obstructing each other, it carries away the vital breaths with pains. When wind is of 5 types, one of the 5 types of vayu, vitiated by dryness, excessive exertion, fasting, excessive eating, injury, travel, suppression or forceful expulsion of urges, causes impairment of the eyes and other senses, and many diseases such as chronic rhinitis, facial paralysis, thirst, cough, and dyspnea. One of the 5 types of vitiated by suppressing or forcefully expelling sneezing, belching, vomiting, and sleep, and by heavy burdens, excessive crying, laughing, and so on, causes diseases, such as obstruction of the throat, mental derangement, vomiting, anorexia, chronic rhinitis, and various goiter and other diseases located above the clavicles. A subtype of, when vitiated by excessive movement, contemplation, play, irregular activities, incompatible foods, dryness, fear, joy, sorrow, etc. Causes loss of virility, enthusiasm, and strength, swelling, mental agitation, fevers, diseases affecting the entire body, pricking pain, horripilation, numbness of the limbs, skin diseases, erysipelas, and many other diseases affecting the entire body. A subtype of vitiated by irregular, undigested, cold, or mixed foods, and by untimely sleeping, waking, etc. Causes diseases originating in the large intestine and stomach, such as colic, abdominal tumor, and sprue. A subtype of provoked by dry and heavy foods, suppression of natural urges, excessive carrying of burdens, and by excessive use of vehicles, riding, sitting, standing, and walking. Causes difficult diseases located in the large intestine. Many conditions such as disorders of urine and semen, hemorrhoids, and prolapse of the anus. And all, one of the three, associated with drowsiness, a feeling of being covered or wet, and heaviness, with unctuousness, anorexia, laziness, coldness, swelling, and diminished digestive fire, and with a desire for pungent and dry substances and alleviation by such substances, should be known as associated with undigested material. That which is free from is characterized by the opposite of drowsiness and the like. Therefore, the enveloping or obstruction of which is of many types will now be explained. The symptoms when is enveloped by are burning sensation, thirst, pain, dizziness, darkness, a burning sensation from pungent, hot, sour, and salty substances, and a desire for cold things. Coldness, heaviness, and pain, and great relief from pungent and other tastes, and a desire for fasting, exertion, dryness, and heat are present when is enveloped by. When enveloped by blood, there is always burning pain, intensely arising between the skin and muscles. There may also be a red swelling and circular patches appear. When enveloped by muscle tissue, there is a hard, discolored swelling and also pustules. A tingling sensation, as if ants are crawling, also occurs. A mobile, unctuous, soft, cold swelling on the limbs, and anorexia. This is known as a type of disorder. It is difficult to cure when enveloped by fat. When enveloped by bone, one desires very hot touch and pressure. The limb is excessively pricked as if by needles. It becomes weak and pains. When enveloped by bone marrow, there is bending, yawning, and a constricting sensation. Pain occurs, and one obtains comfort by pressing with the hands. When semen is enveloped by, there is either excessive vug urge or no urge at all, or it may be fruitless. When is enveloped by food, there is pain in the abdomen after eating, which subsides when the food is digested. When is enveloped by food, pain occurs in the abdomen after eating. When the food is digested, the pain subsides. When is enveloped by urine, there is non-emission of urine and distension of the bladder. When feces obstructed occurs, there is an obstruction downwards, and it causes cutting pain in its own place, the colon. The unctuous substance quickly undergoes digestion aging, and after eating, the person experiences distension. The feces, pressed by food, are expelled with difficulty, are dry, and after a long time. When wind is obstructed by all tissues, there is pain in the hips, groin, and back. The wind moves in the wrong direction, and the heart is distressed and severely afflicted. When life breath is obstructed by one of the three, there is vertigo, fainting, pain, and burning sensation. And when food is improperly digested, there is vomiting. In one of the 5 types of also giddiness, etc., burning sensation, internal heat, and loss of energy. And in one of the 5 types of a pervasive burning sensation, exhaustion, obstruction of bodily movements accompanied by heat and pain. In one of the 5 types of, there is impairment of heat, excessive sweating, restlessness, and thirst. And there would be a burning sensation. When one of the 5S is afflicted, there is a yellowish color in the stool. There is excessive pain and burning in the vagina, penis, and anus. When one of the 5S is enveloped by another term for one of the 3S, there is lassitude, drowsiness, anorexia, vomiting, spitting, sneezing, belching, and obstruction of inhalation and exhalation. When one of the 5S is afflicted, there is heaviness of the body, anorexia, impairment of speech and voice, and loss of strength and complexion. In one of the 5 types of, there is stiffness in the joints, bones, and speech. There is heaviness in all limbs and great stumbling in gait. In one of the 5 types of, there is excessive coldness of the body, lack of sweating, and weak digestive fire. In one of the 5 types of, there is discharge of urine and feces with. Thus, they know the 22 types of one of the 3 envelopment. Similarly, and the other subtypes of envelop each other in due order. One should know that all of these are 20 types of envelopment. Obstruction of inhalation and exhalation, rhinitis, headache, heart disease, and dryness of the mouth occur when is enveloped by. When is enveloped by, there is a diminution of complexion, vital essence, and strength. In this manner, the physician should differentiate all types of enveloping obstruction by observing the locations of the subtypes of, their increase and their decrease through their actions. And there is also a mixed of the 5S subtypes of among themselves, and of the mixed S with the 12S subtypes of etc., and with those mixed S, etc. Similarly, by the mixed S, etc., and by their numerous combinations, and due to the variations in their intensity, the becomes innumerable. The attentive physician should recognize this by the manifestation of its specific symptoms, and gradually, repeatedly, by alleviating factors, even if it is subtle. Life is especially one of the 5 vital airs, and another vital air is called strength. From the affliction of these two, there is a loss of life and strength. The winds that are obstructed, whether unknown or known, if they have persisted for a year, become difficult to cure even with effort, or they become incurable. Abscess, splenic enlargement, heart disease, abdominal tumor, diminution of digestive fire, and other. Complications arise from neglecting those that are obstructed. 58.5. Thus ends the 16th chapter, named Diagnosis of Vata blood disease in the 3rd section on diagnosis of the Ashtanga Hridaya Samhita, composed by the illustrious Vagbhata, son of the illustrious Vaidya Patisamagupta.